thinking, the fabric of our thoughts into practical applications. So it's going to be a great day. Yeah? Nothing's going to be left on the shelf. When you walk out of this room today, you would have learned something that is applicable. If you haven't, please spend time to network further and think, whose shirt tail can I hang on to or suit to get where I want to go? So it's an opportunity. It's taken a lot of organization on the part of KUKA UK, KUKA Kenya to make it happen. We had challenges in ensuring that this conference is given the visibility it deserves because it conflicted with the Oceans Conference taking place in Mombasa. Yeah, where we all learned yesterday that there were some 10 heads of state attending. But all the heads of states here are more than 10, and we want to welcome you this morning. We're very, very happy. Give yourself a round of applause. Thank you very, very much. So as we kickstart the proceedings, I would like to appeal to one of the audience to come and pray for us. Huh? Prayerful lady, can you come and pray for us? Yeah, please. Who could come and please come and pray for us? Huh? Yes, yes, yes. This is your conference. You're not there as a bystander. We need your blessings. So through the grace of God, please pray for the conference. Thank you.
Good morning, everyone. Good morning. Please let's all stand for a word of prayer. My name is Ruth Graham from National Cancer Institute of Kenya. Let us believe and pray. Our Father who is in heaven and is with us right now, we come before thy throne of mercies. We thank you for the gift of life. We thank you for today. As we are going to continue with the conference, oh Lord, I pray so that whatever we are going to discuss, may it be beneficial to everyone. And as we continue to seek for guidance in how diseases can be healed in the world, I pray so that you may be with us. I pray this prayer, believing and trusting in the mighty name of Jesus. Amen. Thank you.
Thank you very much. Wonderful prayers, wonderful prayers. We want to remind our friends that the great philosopher Karl Marx called religion the opium of the people. We love the drug religion. Thank you, philosopher Karl Marx, for making those remarks. But today now, as we populate the auditorium, I want you to take time out and think about the form that you like this conference to take today. We are open to audience participation. We're open. If anyone feels that they didn't get an opportunity to make a pitch yesterday, here's a chance now to come and say your piece or forever hold your peace. So I think yesterday we had a very good session in the TIBA deal room. And in total over the 2 days, we had several participants pitching different investment ideas. So if anyone feels that they were left out, by a show of hands, I will give you the opportunity to make your statement. If not, intermittently during the course of the day, we will still have this participatory approach where our delegates can come and have a say at the conference. So thank you very much. Dr. Lucas, can I call on you to make a few opening remarks? Yeah, as we proceed with the conference.
Good morning, everyone. Good morning, come on, good morning. Okay, so today I walked in and somebody says, you're not feeling cold. And I'm like, what do you mean cold? Who's cold? Who's feeling cold? Nobody's feeling cold, come on. So I must start by saying that I have learned a lot from a lot of you. The little discussions we've had and people come to you and say this, this, and that, it's been really, for me, it's very edifying. And sometimes you think the people who are holding the mics know it all or are the ones that are actually, you feel like you're the ones who are receiving everything. But it's amazing how much you receive when you're on this side too. The interactions, the eye contact. Sometimes, yesterday when we were doing the panel, I would look and I realized, oh, somebody just looked at me and is like, what did you just say? And I had to correct it because it's an interaction. We are interacting here, and I really appreciate that. There is a team that I want to surprise you actually with. There's a couple students from a school called Meru. They have been sitting back there showing funny pictures, and nobody seems. Has anyone been to that corner right there? Has anyone been there? Okay, one person. Anyone else? Two people. Who else? What is that they're doing back there? I mean, they're in the same room where we are. Okay? Who has been observant enough to understand what they are doing back there? Actually, for a prize. Who knows what's going on there? 5, 4, 3, 2, 1, all gone. Okay. So I'm going to invite Ezekiel. And I'm going to invite Ezekiel and Nyawira, right? Yes. Ezekiel and Nyawira, come up, please. Please come up. I'm sure you're dressed for the occasion. They look dapper. And I think for today, I think we're going to vote that Mr. Karen is actually, please stand up. Please stand up. He is the darkest. He is the most dapper. Sorry, King. Look at how sharp the guy looks, right? Thank you. So, Ezekiel? Yes. And Nyawira. Is this working? Please say, please, this is impromptu. They didn't even know this is happening. And I think their professor, Professor Amiri is not here. Please tell us your names and then tell us what you're doing back there. And don't take forever. It's not a sermon, eh? So make it quick, sweet, and go for it.
Yeah, good morning. My name is Otieno Ezekiel. She is Anne Nyawira. We are both master students from Meru University, Science of Technology, taking Master of Science Physics. So back there, we have a low-cost AI-powered digital microscope.
AI-powered digital microscope.
So the digital microscope, we are the one who fabricated in the university and now try to use the microscope for accessible malaria and cancer diagnosis.
Okay, great.
So the microscope is digital, can you see? It is digital. If you compare to conventional microscope or the optical microscope, whereby it has mouse, the keyboard, and the specimen you see on the screen, meaning that when you are using the microscope, you cannot able to strain. Second, the microscope is very cheap. The cost of fabrication of the microscope is 30,000 shillings.
Wait. Is that cost of fabrication?
Cost of fabrication.
So if I wanted to buy one, how much do I buy it for? Because you don't tell me about the fabrication. I want to know how much I pay for it.
So if you have 40,000, you'll be able to have the microscope.
How did you come up with 40,000?
Of course, I say the cost of the fabrication is 30,000. And of course, when after fabrication, we install the artificial intelligence and the algorithm that ensure that it runs. Because once you have the microscope and you have the slides, you will not go a cost of making the microscope to become the focus. We have the artificial intelligence that does the work itself.
Okay, so where's Wangari? Where's Wangari? Wangari, I think you have a couple of folks here who really want business work. He just came up with 40,000, and I don't think that is the right amount. So I think you need to see that lady there. She's really good at business. How do you change? If you're making it for 30,000, I don't think 40 is the right number.
Yeah. And this is the thing, yeah. So that was just the number coming up, but we are expecting to lease it out so that we're able to charge the subscription fee. So once you're able to use it, because at the moment when you're able to acquire it, then we're able to give you the direction how to use, because when sometimes it may get damaged and we'll able to make the processing, make to repair it.
Good.
So once we able to have the certification fee,
Yes.
then we'll able to move.
Okay, I like that. Want to hear your voice.
Good morning.
Morning to you.
I'm Anya Wera, a master's student in Mary University, doing Masters of Science in Physics. The microscope you see there is 3D printed. That is why we say it is
3D
cheap.
printed.
Yeah.
Okay.
That
More
is
is
why
coming
we say
out.
it is low cost, and you can access those 3D printed parts online. So it is open source.
Okay.
Yeah.
So to wrap it up, it's a 3D printed digital AI driven microscope that they fabricated for 30,000. I will bet you there's several hospitals in this country who don't have a microscope or a working microscope, right? So how do we now, this is the practicability of sessions like this. How then do we decide how can we get those ones to those hospitals? That's number one. Number two, somebody here yesterday said about scientists and businessmen. Somebody said something about businessmen and scientists and talked about sometimes we scientists do not really understand the business side of things. And this is exactly what I'm trying to suggest. This is why we are here. How can we work together to build? That would probably not be 40,000. I think it'll probably be more. And if you're doing a subscription, it's probably going to be a different rate. There is a business model to be developed. And there is somebody who's going to be able to actually be able to use that. I remember yesterday we were talking to Uje here. They want to improve care, and this is how you start doing it. I mean, they've been sitting back there, so please swing by there, talk to them, say hi, and get to understand how did they come up with it, who came up with the idea, and then it's been patented, right? You're in the process of being patented? Good. So it's being patented, so nobody's going to steal the idea, right? So thank you very much. Give them a hand clap. So today is going to be a very interesting day. There was a lady who was flying from the UK and missed her flight. So we're going to change that to, let's see here. Okay. My apologies, I need to check something. Meanwhile, what we're trying to achieve today is I'm going to move the mic around, and we are trying to say, give us 1 or 2 words about this conference. What do you think what 2 words can you use to describe this conference? So we'll move around and collect that information. Just say whatever it is. If you think it was boring, if you think it was fun, if you think it was informative, if you think it was whatever you want to say about it, we will collect that information, and we're trying to make something like, you guys know what a word cloud is? Want to develop one. So let's start from here. We'll just pass it around and see.
New relationships.
New relationships, okay?
Yes, good morning.
Good morning to you.
I'm Simon Munya. It was informative, and I managed to network somehow.
Informative and networking.
Good morning.
Good morning.
All I can say it was about collaborations.
Collaborations.
Yeah.
Nice. Okay. Very good. Let's go back here.
Good morning. I'm Eunice Kuria from a regulatory body called Clinic Officers Council. I missed coming the days, but today I'm here, but I'm sure networking is key.
Networking.
Hi, thank you. I'm Rachel Parker from King's College London. I would say informative and inspirational.
Informative and inspirational. I like that.
Thank you. I'm James Nono from Maseno University. And for me, I think it is partnerships for scientific innovations. Thank you.
Good morning. I'm Dr. Kibet from Waikibaki Referral Hospital. I think for me, it has also been quite informative. I've gotten some contacts that I will also be using to see how I can partner, especially in areas of research and training and innovation, and see how.
2 words.
2 words.
Yes.
Okay. So it's been interactive and building.
Interactive and building.
Yeah.
Stacky testimony. I said 2 words, 2 or 3 words. That's it.
Morning, I'm Dr.
Morning.
Soita, also from Waikibaki Referral Hospital. I think the conference was extremely informative, and probably another word is partnerships. Thank you.
Partnerships and informative.
Good morning, everyone.
Morning.
I'm Dr. Gabriel Oma from the Jaramogi Oginga Teaching and Referral Hospital. I think from my end, basically opportunities and transformative opportunities.
Opportunities and what's the other one? Sorry, I missed the one.
Generally, transformative opportunities.
Transformative opportunities. Mnasikia Kiingereza? Aya.
Good morning. My name is Samuel Kibonge from PATH. For me, it was setting the pace for new innovation.
Setting the pace for new innovation. That's more than 3 words, but yes, got it.
Yes, good morning. My name is Wilson Oino Pudo from Kenya Red Cross at the International Center for Humanitarian Affairs. For me, it's about synergy and areas of complementarity. Thank you.
Complementarity. There you go.
Good morning, Professor Ngacho from Masinde Muliro University. It's informative but lacks, it's informative technically, but for managers of institutions that handle cancer and related diseases is lacking.
It's lacking?
The non-technical issues, because the technically is informative, but the institutions have to be managed.
Very well. So that was a testimony, but that's okay. 2 words. It was a little lacking, informative, and a little lacking on the management side. Got it.
Good morning.
Got
I'm
it.
Rebecca. The conference was informative and partnership also, I'll say.
Informative and partnership. Partnership keeps on coming around. Okay, go ahead.
My name is Elizabeth Mutuku, and for me, the conference was, I saw opportunities for health data and research.
Great. Health data and research.
Yeah, Professor Solomon Ogara from Jaramogi Oginga Odinga University of Science and Technology. For me, 2 aspects. One is the creativity and the aspects of ideation for those in digital health.
Creativity and ideation.
Thank you very much. I'm Dr. Jen Owenga from Jaramogi University. I've appreciated the role of One Health in prevention and control of diseases, of non-communicable diseases.
Rudia yote na tafadhali. It's supposed to be 3 words, but rudia.
Appreciation of One Health in prevention and control of non-communicable diseases.
Okay, you heard it.
Good morning, everyone.
Good morning.
I'm Caroline Cheto from State Department for Industry.
Oh,
This
nice.
is my first day here.
Oh, your first day here?
Yes.
Oh, you missed a lot. You missed a lot. You'll catch up, don't worry.
Good morning.
Good morning.
Dr. Mary Kibote. For me, it was thought-provoking.
Thought-provoking. She's one of those ones, Dr. Kiboge. Every time I'm here and I look at her, I can tell the mood. She's smiling sometimes, and sometimes when she closes her eyes, I know I said something that wasn't right. So I have to rethink and correct. So thank you for that feedback. Kerry.
We're spending too long together because she's just taken my word, which was thought-provoking. But I think the other one would be opportunity creating.
Thought-provoking and opportunity creating. Amazing. Sorry.
Good morning, everyone. My
Good
name
morning.
is Ruth Graham from National Cancer Institute of Kenya. What I have in this conference, I have learned a lot, and I'm appreciating the discussions from the scientists and the researchers in this meeting. Thank you very much.
Thank you very much. King. You don't qualify to give a word. You've been giving words.
Good morning, everybody.
Good morning.
For me, the conference was eye-opening.
Eye-opening. Some people follow instructions. Eye-opening. 2 words. Okay, go ahead.
Good morning, everyone.
Good morning.
My name is Kosienya Bernard from St. Paul's University. It's not
St. Paul's in Limuru?
Yes.
Oh, nice. That's where my wife is from.
So the conference was innovative and collaborative.
Innovative and collaborative. This English, nakwambia. Aya, yana hapo nyuma.
Morning, everyone.
Good morning.
Maureen Jiru, Pharmacy and Poisons Board. The conference was included knowledge sharing and collaborative.
Knowledge sharing and collaborative.
Hi, for me, there's potential for more collaboration.
Potential for more collaboration. Interesting. Potential. So what did you get from it? Yeah, I know the potential. How did you get to understand the potential? What gave you the thought that there's going to be potential?
It's number one from the constitution of us who are attending this from different institutions, different parts of Kenyan government, private sector, and everyone is like we're fitting to a big jigsaw, and everyone has a part to play in that.
Okay. Everyone has a part to play, and you are from different organizations.
Yeah.
How many people have you met that you did not know? There's a team there that came from a hospital, like university, and they're sitting together. So if you sit with the same person you came with from wherever you did, unasambaza kweli. Hebu niambie, how many people have you met, knew that you didn't know?
Many, I don't have exact number, but
A
I've
good
met
number.
people from the Cancer Institute, universities, and also the Ministry of Health.
Great. Thank you very much. Okay. 2 words, please.
Good morning. I'm
Good morning.
Karen Chebet from State Department for Environment and Climate Change. The conference has been informative.
Informative. Okay. Sir, we are saying 2 words of what you think about the conference.
Good morning.
Upon a testimony. 2 words. Good morning.
Good morning, everyone. I'm Dr. Peter Muiruri from Waikibaki Referral Hospital. I think the experience has been really exceptional. It's a great learning curve, and really looking forward to implementing some of the things I've learned.
Tulisema hakuna testimony, but that's really cool that it's informative. It's going to be.
Good morning, everyone. My
morning.
name is Brian Anyega. Unfortunately, this is my first day, and I hope it will be informative. Thank you.
He's hoping it'll be informative. I think there's some people who sneaked in. Let me see. You would have created Muksao.
Good morning, everyone. My
Morning.
name is Edwin Seonda, Africa Health Business. Unfortunately, it's also my first day here. I'm looking forward to health innovation. Thank you.
Another person who came in late. Hii mambo hii hatupendi hii, hatufurahi. Aya. There's a good friend of mine here. I want to start with you, please.
Good morning.
Good morning.
Otara from Egerton University. Biggest tech is the convergence of medical science research and investment. Thank you.
Convergence. Let's just imagine big words we're using. And he's a very good golfer too. Let me just, I know I've seen him swing a little bit. Go ahead.
I'm definitely not a good golfer. My name is Oliver Johnson. I'm an academic at King's College London and director of King's Global Health Partnerships, which supports some of our partnerships in Africa. And 2 words for me. One would be relationships. I think I've really built a lot of relationships in the last few days that I think will be the groundwork for a lot of collaboration going forwards. And I think the second for me is ambition. I'm really inspired by the level of ambition here in Kenya's health sector for where things can go in the future.
There was a testimony there, but it makes sense. Ambition and collaboration, partnerships. Now it's for you.
Hello.
Hello.
Ajay Shah, King's College London. Entertaining and collaborative.
Oh, entertaining. Mr. King, so finally we got something. There you go. 2 words for the conference, please.
Good morning, Richard
morning.
Cowan from Christie in Manchester. Optimistic
Optimistic.
and it goes to, and I suppose hopeful. Those are the two which haven't been done. But obviously, a lot of comments, and to add something else, I think personal relationships. You can't take things forward without having personal relationships, and this conference has allowed that.
Yes, I figured out I had a brother here that I didn't know about. So, who has not? Oh yes, Professor, you were not here when your students were speaking. So go for it.
Thank you. Good morning. My name is Professor Joshua Rim from Meru University of Science and Technology. The conference has been multidisciplinary in nature and collaborative. Thank you.
Collaborative and multidisciplinary in nature.
I might say I'm from food science background, so I'm enjoying the sessions. Thank you.
Enjoying the sessions. He had to put a testimony at the end there. Okay, there you go.
Habari zenu.
Mzuri sana.
My name is Sewe Malamba. I'm from University of Nairobi. I have more than 2 words. Number one, I've learned so much. Those are already 5 words.
Uh-huh.
Yeah. And then number 2, I was happy to meet some of my ex-work colleagues from my past work life.
Uh-huh.
And then number 3.
So reunion. Uh-huh.
Yeah. And then number 3, I'm sad because I've been sharing some of the information being given here. I'm sharing them out there. And looks like most of Kenyans are not aware of what KIE and special zones are doing, and
so
ability to
informative.
fund.
So you learned something new.
And then I was sharing with Kenyans, and Kenyans are not aware. In fact, there was a project, is it KEFA, the one they were doing in Kisii County, the one for the community mobilization for screening of that cancer.
Yes.
Actually, I may have caused a ruckus on social media because I mentioned about that project, and apparently the local media has never covered it. So everyone is on my neck asking for that
Madam
information.
Allison?
So I'll even be
introduce you to Madam
grateful
Allison.
if we could get more information about that project so that it can be, it can be passed out to the world so that Kenyans are aware. Plus all these other good things that are happening here that Kenyans are not aware.
So that moved from a testimony to a speech, but it made sense.
Shukran.
Thank you, thank you. I'll introduce you to Madam Allison, who was doing that project, actually.
Hello, good morning.
Good morning.
For me, this has been a provocative trigger for sustainable action.
Provocative trigger for sustainable action. Provocative trigger. See, she sits back there. Even yesterday, she was at the corner there quietly. Still waters run deep. That's what they say, don't they? So thank you so much for sharing. Thank you for being so kind with your words. And it's important that when we go to some of these sessions, a lot of times you don't hear from what the audience see. And I really appreciate you sharing. There are 2 people who sneaked in. I know I've seen you. I see you, Joanne. I see you. Yeah, I'll come to you. So 2 people, and then we'll move on. You sneaked into 2 words about the conference. I saw you. I'm looking.
Hi, everyone. I'm Alvin Mase, a student at JQuat, as well as industry. I was in my Nexus. 2 words, personal and opportunistic, because from every presentation, there's a personal inclination to it, and there's an opportunity to solve that personal problem. Thank you.
Great, personal and opportunistic. Now, I'm going to the camera folks, both the media folks. Yesterday, you were being fired. I'm going to give you a chance to say 2 words so that you can have your chance. Joanne, sorry, I know you're having tea, but I need to hear your words. She's another one who's very deep.
I think my takeaway from yesterday was, I think, collaborations and getting all these ideas from different expertise. So, yes.
Collaboration and getting information
So I was
from different.
challenged.
You were challenged. She was very challenged. She's one of the very smart ladies in this room. Sit down with her. She is very smart. Okay, your chance now. Tell us. What are your 2 words for, you've been taking videos and all that. Let's hear what you've seen.
Okay. Good morning, everyone.
Good morning. And say your name so that they know.
Okay. I'm Timothy Monai. The conference was very educative, and we get to learn new things every day. And I'm very thankful for that.
There you go. You see? Even they are in the room. We just assume that they're not in the room sometimes. Let's hear what these folks are saying here. And we're not going to be firing anyone.
Good morning.
Good morning.
I'm Victor Yacharo from Kavik Media. This was thought-provoking, and I hope that it actually is going to work for those who are currently facing challenges with regards to cancer.
Please pass to Sam there.
Morning, everyone.
Morning.
My name is Samuel. The session is very innovative, inspiring too. I appreciate everyone for the effort they are putting to bring this to Kenya.
Madam, you sneaked in. 2 words of why, what you liked about the conference.
Hi everyone, my name is Kimberly. What I liked about this conference is about the innovation, and then now the next thing is what's next after that.
So nobody has talked about that. What's next, right? How do we implement it? What happens after this? Nobody mentioned that. I think that's a very important part that we have to do too. Come on, sir. Tell us something.
Good morning, everyone. My name is Isaac Werimo. What I can say about the conference is the innovation part. I think normally we say put your mouth where your money is, but here...
Put your money where your mouth is.
Yes, but here, put your mouth where you see money.
Put your mouth where you see money.
Yeah, so that you can get to,
Very interesting.
Thank you.
Okay. Mr. Dixon, Professor Dixon, what 2 words for the conference?
Not 2 words, 3 words.
Oh, 3 words. Okay, let's hear the testimony.
Those who makes things happen, those who are there when they are happening, and those who have no idea what is happening. Where are you after this conference?
Those are 15 words. There was supposed to be 3. Wow. Okay. So I think, of course I was going to come back to you.
Thank you very much, our moderator, our co-MC. I think we've learned a few things. I am not constricted by words, and I'm not conflicted by your thinking. Our theme for this year's conference, you can see quite clearly, is Building Kenya and Africa's Health Innovation Future. Yes, with the limitation of our thinking and driven by the intellectual capacity of both our Kenyan Research and Innovation Technology Hub in the medical field and our friends from University, King's College London, Manchester University, and the other disciplines. I think Christie's was here with the professor. This theme was eventually expanded to include trade investment. The original theme and focus was principally on the medical side. So the themes were, we're looking at the cancer track, we're looking at the kidney disease track, we're looking at health and security, and then a contemporary track on climate and One Health research and innovation. And then to cap it all, local manufacturing was brought in. So Professor from Maseno, I take cognizance of your comment that it should be expanded to include a management component. Health management component is very important. And I want to invite you to the forum because you're a man with a big brain and many thoughts, just to give us a pitch so that as we move forward to the next conference, we can include health management initiative. Would you like to take the podium? Come forth, please. Thank you. Thank you. Come on, give him a round of applause. wants to expand the frontiers so that our theme, come sir, we'll give you 5 minutes to make your pitch.
I will take less. Thank you so much. I'm from Masinde Muliro University, one of the institutions that were the regional arrangement of the institutions to offer this training. My point was that some of us who come here, we are not in the area, the medical field. We are here as the coordinators, as the managers of the institutions that are supposed to offer training, that are supposed to offer these services. So as we sit here, we talk of the technical issues, how can the screen can be enhanced, how the treatment can be done, but we ignore the infrastructural organizations of these institutions of training, the curriculum components of the training, so that we collectively contribute. More so, the public institutions that we are here. Of course, the funding could be there, but how do we organize ourselves as institutions? How do we collaborate so that we can enhance the screening, the training, and the treatment? Thank you very much.
Can we a round of applause for Professor? Thank you very much. And so that these thoughts are incubated by our partners from the UK. Oliver, can you please come forth and give a response to that? Because we'd like to know that you've actually taken cognizance. Yeah, but I want a response to that. Please, let's have a response from both of you. Prof, please come forward. We want to hear your thoughts on that. This is a major takeaway. Thank you.
Well, we were outside in that exact moment planning the next session, so I'm not entirely sure what we're responding to. We're happy to build on the next session, but we were just outside in that moment. Apologies.
The gentleman from Masinde Muliro was suggesting that not only scientists come to these sessions. Some of the people who come here are not scientists, but they are the managers who make things run. So then when we talk science, and then we don't talk how do you move from that science to manage to have solutions or to have, to the end. Then you have one team here and one team here who doesn't understand why you're buying this and this. So that connection, that's what you was talking about.
So shall I go first, Prof? And I just started in an academic position at King's in something called health systems science. And that's because health systems it's about health workers, but it's about others as well. And the team that we're pulling together to work on health system science includes health economists, it includes anthropologists, it includes managers, it includes a whole range of people who need to collaborate in order to get health ideas translated into health outcomes for people. I'm part of a Lancet commission at the moment looking at the collapse in trust in traditional health services around the world. My sister's a public health official in London dealing with measles. We've had 2 measles deaths in the UK this year, a disease that we had thought was eliminated because communities are no longer having their children come for vaccines due to shifts in trust. And on this Lancet Commission, we have the Archbishop of Cape Town, we have theologians, we have anthropologists, because if we don't understand how communities trust in health services, and if people are not engaging to access health services, we cannot translate to health outcomes. So health is a team sport. Health requires a lot of different disciplines together. That's in the work we do. We're trying to embed those different aspects of expertise together. And if we in this KUKA Alliance are trying to improve health, we've got to bring a range of colleagues together to look at this. We've heard a lot about cancer in the last few days, and it's been great to see from a One Health perspective, people in agriculture involved in this, thinking about prevention and so on. So for me, if we're going to tackle health, we have to do it across different disciplines. If we're only speaking to each other as health professionals and scientists, we're not going to be able to translate things for communities. So I think it's a great question. I think it's exactly where we need to be heading. And our institutions, which are often structured in silos, with a medical school and separately an anthropology school on a different campus in a different place, we've got to be able to break across these silos and speak a shared language to work together. That would be my thoughts, but Prof.
Thank you, Oliver. It's a great question, and I'm going to extend what Oliver was saying. The question is about collaboration, and I think collaboration has many different components. We've just heard about one aspect of collaboration relating to health. I think we can also discuss about collaboration across health professions, multi-professional collaboration. So doctors, nurses, other health professionals. And when we consider the challenges that you face here in Kenya, but actually we face everywhere around the world in delivering healthcare, I think we have to consider, we have to imagine new ways of dealing with this, and we have to move away from old rigid boundaries about what particular professions do and think about how we work more closely together. I was having a conversation earlier on about physician assistants and the challenges and sometimes conflicts between physician assistants and doctors. And the conversation that we were having was about looking to the future and thinking about what was really required to do something and to focus more on the challenge and the problem that needs to be solved rather than rigid structures. So I think collaboration across professions is a very important part of tackling the health challenges we face. I think the other kind of collaboration that I would think about is collaboration beyond the health professions. Again, if we think about many of the challenges that we face, we do need, I think, a contribution from other professions. We need a contribution from almost any profession, to be honest. We have had a discussion in here yesterday about innovation. We had people who are in business. We have people in science. We have people who are in engineering. We have people who are in logistics. We have people who are in telecommunication. All of these different disciplines are required. So I think my thoughts, my conclusion, my short summary or answer to that question would be to be driven by the problem, to be driven by the challenge, and bring to the challenge whoever can add some value to solving that challenge, to form a team. And collaboration is about added value. It's always about added value. So if you can bring 2, 3, 4 different groups, different teams, different types of people, different disciplines, and collectively add value and do better than you can individually, that's the way to solve the problem. But for all the things that we are discussing, every single topic that we've had, it's actually about collaboration. So it's a great question. Thank you.
Round of applause. Thank you very much. As they leave the podium, big round of applause. So back in the day in Kenya, we've come to embrace democracy. And democracy, can take many, many forms. Back in the day, we had Mulolongo, where you would line up and you'd be counted. We're not going to line up and be counted. I just want a show of hands that the resolution made by Professor there that we expand the scope of topics and include health management in the 5th KUKA Conference on Health, Innovation and Research will also include management in it. Can I have a show of hands that that resolution can be adopted, please? A show of hands. Can we adopt that resolution? There are some medics here who are not happy with that. We need to manage them better, I think. They look at life under a microscope, but there's a great sense of an environment in which the medical profession and medical practice belongs. Now, let me take the opportunity. We are very honored to welcome another wonderfully renowned Kenyan entrepreneur and medical practitioner. I think Dr. Amit Thaka is in the house. Dr. Amit, you're here, please come forward and let's give him a big round of applause. He's the chairman of African Healthcare Federation, founder and board director of Healthcare Federation, chairman Healthcare Federation, and the co-founder of Avenue Healthcare. Come on, a round of, yeah, he's here in person, please. Big round of applause. Sir, the floor is yours.
Thank you so much. Good morning, everyone. Let me just say, it's really great because I've interacted with some of our visitors from UK, and I've seen some really prestigious entities and some really great professionals. And what struck me when I was at the BHC residence engaging with some of the colleagues who visited us and the partnership we are creating, also to mention the governor of Kisii who was there at that event, that this partnership can offer an amazing amount of impact in the health system. There's a lot we can share with each other, and there's a lot of gains we can have with each other. One big area of our discussion has always been around how excellent some of the facilities are in the UK, and also how amazing some facilities are in our own country, Kenya, where I've been in the business for about 30 odd years. Health systems require deliberate and conscious engagement with both public and private. You only get healthcare from two spaces. You either go to public or you go to private. Everything state and non-state. So if you're non-state, you're visiting any entity that is known as an NGO, CSO, commercial entities, and so on and so forth. What does this really mean for us in Kenya, and why is it slightly different from UK? And if we make the collaboration happen, what do you think is the real quick win for us in the next 12 to 24 months? One big difference is how we pay for healthcare. It's clear. Ask anyone in Africa, in Kenya, they'll tell you how they pay for healthcare. And another thing you can ask them is, if you had the money, would you go to private or public? Where would you go? You hear that? Go to any African country and say, if your family member was sick and you had the money to pay for treatment, where would you go? Why? Ask that to the UK resident. They find it puzzling. Because the funding system matters. Where you go and how you manage. We have a 50-50 model, actually. Half the healthcare is provided by non-state, and half the healthcare is provided by the state. The money that we pay in tax that goes to Treasury is struggling to look after the people who may not have the means to get access to healthcare. Do you know how much we spend? How much do we spend per person? Guess. Okay, let's start with US. US spends $10,000 per person per year on healthcare. That's how much they spend. UK, what does UK spend? $4,000. Maybe $4,200. We're trying to get to 100. You see the difference? So the $100 are better off shared, hopefully, to those who don't have means, so you give them a double or a triple sort of model, and those who have means get now private insurance, go to private care. We all have been part of what you call fundraising. You all get messages, isn't it? Relative has to be discharged from hospital. And this is the reason why we introduced a UHC model, and many, many countries are struggling to get a funding system, and we are trying in Kenya to have SHA, the Social Health Authority, with 3 clear defined medical funds to enable larger population to get access. Of course, it has challenges, it has problems, but the idea and the concept is great. So for today's conversation, what I really want to talk about, that healthcare financing is critical when we talk about collaboration. Healthcare is costly. Healthcare cannot be free because you need to buy all these products. These products come at a price. Services and fees you pay to professionals come at a price. So healthcare cannot be free. Nothing is free. In UK, it's the state who's paying. So NHS receives the funding and pays for this. So somebody's got to pay for healthcare. I hope that this conversation and collaboration makes us as champions and partners in healthcare, whether you're in academia, whether you are in service provision, whether you're in financing, whether you're in policy or ministry, allows us to shift our discussion from healthcare to health. Far too long, we've continued to pay for healthcare. We need to start paying for health. It will shift dramatically how families feel, how professionals react, how institutions manage. Because prevention is better than, prevention is cheaper than. 70% of our patients in Kenya walk through my facilities, hospitals, everything, with preventable conditions at outpatient level, 70. The healthcare does not start at the hospital doorstep. It starts at the household. Healthcare starts at the household and not at the hospital doorstep. This means things like vaccination, hygiene, prevention, nutrition are all elements that will keep people out of facilities. Do you remember COVID? Do you know what we did? Everyone was asked to regularly wash your hands. Are you still doing that? Do you know how you wash your hands? Do you remember those days of sanitation? Just imagine those days. Do you know what happened? 48% drop in all GI tract infections at outpatient in our country. 63% drop in URTI. Do you remember? Everything went down. So there was, pick that good element of let's pay for health and not healthcare. You don't need a pill for every ill. So we are not in the business of buying pills. So this dramatic shift, and if we can get that partnership going with the UK, I think it'll be fantastic. And my challenge to all the academicians and the large university hospitals, research entities, oncology is great to talk about. NCDs are great because we have to deal with diabetes, hypertension, oncology practices. But let me tell you, the real primary healthcare issues that we face in developing countries is primary healthcare, with 70% walking into our clinics every day with URTI, gastrointestinal problems, children with diarrhea and stuff like that. Imagine the bulk of healthcare we can produce if we focus on 70%. This is what's going to transform a lot of the healthcare practices across Africa. And it doesn't take much. This is what we need to do with counties. We have 47 counties. Each county leader, I heard the gentleman from Masendi Muliro, in your county, it's all about what are the deliverables that we want to achieve with primary healthcare. What can we do to keep people out of hospital, not once they're in hospital? And we can manage this through simple engagements, through simple awareness, through simple practices. And this is something that I hope our partnerships yield. But as I end, I want to talk about just one more item that I was asked to speak about, and that was centers of excellence. We're talking a lot about centers of excellence, great stuff. Look at Abuja, we've put up a nice entity there. Look at maybe Lagos, or look at Addis, or look at Nairobi. I mean, these are great centers of excellence. Centers of excellence are absolutely vital. But let me tell you 2 reasons why we have $7 billion moving outside Africa. How much? 7 billion every year. Kenya, how many? Incoming 12,500, outgoing about 22,000 annually for treatment. The ones we know. The ones we don't know, maybe many more. Where do they go? Which is the one country that's leading? Many years ago, there were 4 or 5 countries. One was UK, one was South Africa, a bit of US, a bit of Turkey, a bit of Thailand. South Africa used to get about 10. Remember South Africa? Our patients used to go there. 10% travelers. Now, how many percent? 1. So, who moved my cheese? What did India do? India gets how many percent? How many? 95%. They took, and it's not only, go to JKIA today. Do you go to JKIA? You'll see wheelchairs. Where are people going? Where are they coming from? They're not only Kenyans. You see flights coming from Lagos. They stop here in Nairobi. They change a plane and go to India. Centers of excellence. And why are people going? And would you go? Would you be okay going if you had to go? Because you've heard people going, right? Of course, there are difficult cases, but generally, what have you heard when people have gone there? They've got 2 things. They only travel for 2 things. One is cost. Have you heard that? Many of our family members, they say, oh, you know, these doctors in Nairobi, these hospitals, these private hospitals, the cost is very better we go to, because the cost is. One thing that drives people there is the cost is low. But you know what they're saying? They're not talking about money. It's not the cost. They are telling you value for money. It's not looking for cheap. It is looking for value for money. So they've got the things right. If you do a cardiac bypass, if you do hip replacement, if you go for dialysis, even second opinion. The second thing they've done is they have focused on quality. So the quality is about communication when you go there, how you get your access to drugs, how they communicate with your family. So the second reason they go is quality. I told you they go for only 2 reasons, cost and quality. Cheap can be expensive, you know that. Not everything cheap is good. So you've heard of the word cheapensive. So it can be cheapensive. You don't want to go for cheapensive care. This has been deliberately done by the Indian community and the Indian country system over the last 3 decades. They focused on 2 things only to make them leaders. Number 1 is, it's called Make in India. It was a deliberate engagement of Make in India. When you make in India, they became the basket and manufacturers of products that we see today. Even during COVID, when you had vaccines, many of them were made in Kenya. Some of the companies in UK are making all the stuff in India. So it became a manufacturing hub, and everything was made in India, right from gauze to gloves, to pharmaceuticals, to vaccines. What it did, it transferred the saving and the pricing to the people who live in India. So the prices are, you know, in India, you don't need an outpatient cover. Here we need, right? In India, people don't have outpatient cover. You walk to a pharmacy and you try and get any tablet, look at the price. And you know what they have? At the back of every drug, they've got RRP. What is RRP? Have you seen that stamp? RRP has reduced catastrophic expenses for all the people living there. Recommended retail price. It's written 2 rupees, 4 rupees. And they still make profits out of that. Same thing here, if you transform it, you'll be paying 400. You see the difference? This is the bulk of the treatment. So it's RRP, it's transforming prices, and that is because it is make in India. Local manufacturing is an important part. The second thing they did deliberate was they decided health workers matter. You don't produce health without health workers. You can have great facilities and great products, but nobody to administer for you. They have a high number of population. You know the population of India? 1.5. Population of Africa? Similar? How many countries in Africa? How many countries in India? See the difference? Even the business community, how many licenses do you need in Africa to sell to 1.5 billion people? If you have 54 countries, chances are you need 54 licenses to sell to 1.5 billion. In India, how many licenses do you need? Work out the maths. It's pure economies. We don't need to be a rocket scientist to see. The deliberate attempt to bring more health workers and to train more doctors and to train more specialists enables you to manage the supply-demand curve. If we had only 2 cardiologists in Nairobi, right? Do you know what the price would be to see a cardiologist? Unaffordable. They would charge 100,000 shillings per consultation. Would some people go? Some people will still go? Yeah. And they'll say, I see 3 patients. That's all I need to do. If we had 1,000 cardiologists, the fees will go up or down? Supply demand. We need more specialists. We need to have clarity on how to deliberately get those doctors and specialists up, because automatically the prices will come. It's simple curve, it's economics. And now, I think there's one critical, flattener in healthcare costs that's coming in very nice. It's called AI. So we need to use technology and AI to make the healthcare costs better for the next generation. I'm estimating that this technology and AI will reduce the cost by half. For everything we try and get today, our next generation is going to get it by half. How? Because you don't need to travel to see a specialist. You don't need to catch a flight. You don't need to do any of that. And you don't need to be a super specialist with the AI. AI is going to make a work of a gastroenterologist, a cardiologist, a nephrologist, a neurologist, everything to be more available at the most basic level. I don't think AI is replacing doctors and nurses. Don't get me wrong. I'm not saying AI is replacing, but I'll tell you one thing. Every doctor and nurse not using AI is going to be replaced by doctors and nurses using AI. I think we'll come to a time where if a doctor prescribes you without an AI referral, the doctor will be sued. AI is non-negotiable for the health of our families and our people. Gone are those days that we assume that doctors know everything. By the way, medicine is so large. Not a single doctor in the world has anything to say, I know everything. Forget it. Impossible. There's no way they can remember drug interactions, conditions. So forget it. No matter which part of the world they are. So AI has to be part of the center of excellence as an underpinning matter that I wanted to bring. But the 2 main factors when we do centers of excellence is cost needs to be affordable and quality needs to be top class. This collaboration at KUKA and the fantastic institutions in UK and the collaboration spirit we have in Kenya, I think will take us to greater heights. That's what I wanted to mention. Thank you.
Wow, wow, very inspiring, very inspiring. Thank you very much. Another round of applause for Dr. Amit Thaka. As you have discovered, we have our own medical health rock stars, and he stands at the top of the pyramid there. Thank you, Dr. Amit. There's some great takeaways from that. You benchmark our medical system with the Indian medical system and showed the practice and principles of unlocking the value of our medical industry in this country. The cost aspect, the technical aspect coming to local manufacturing, and more so, the overarching importance of Kenyans taking the responsibility of ensuring that medical practices are customized and they're Kenyanized through the technology that is available to us and through the use of AI, artificial intelligence. People like myself at my age felt at one stage this AI thing is for the Gen Zs and the other generation. But in the fullness of time and with the access to information and training, we have found AI to be a very, very good tool. We are business analysts. We are professionals in what we do. And AI is not there to replace. AI is an assistant. Yeah, it's there to assist you in your profession. And our concept of AI needs to be developed so that we can now learn in Kenya how to develop our own AI tools. And this is something we've been addressing with colleagues over time, that the availability of bandwidth, availability of internet application here in Kenya only speaks to streaming, speaks to emails, speaks to TikTok videos. It's very narrow. And with that limitation, it's very, very difficult for our software technologists to develop AI tools. So we're calling out to the Safarikoms, we're calling out to the service providers to give us greater bandwidth, release us, set us free, so our youth and our Kenyans in the space of digital economy development can have access to greater bandwidth, higher speeds, and do things that speaks to Kenyan AI development. Because without the culture of Kenyan going into an AI tool, we'll be doing things perhaps the way the Chinese do it, doing things the way the Americans do it. It's very sensitive, that issue. The cultural aspect of AI in what you're doing and its application. So on that note, let's give Amit Thaka a wonderful round of applause again. He's a pioneer in the medical field. He's a private hospital owner, medical services owner, amongst other things. I know others have come in whilst we have been in session, and perhaps you can just stand up, sir, and introduce yourself. Yeah, I'm looking at you. Don't look so surprised. We want to know who you are. Yeah.
Hello, my name is Norma Grant. I'm a, senior systems analyst for, over 50 years, I think. Unix systems administration, Linux, all of that. It's interesting that you pointed AI. It does take a lot of data center to pull your own AI, but the infrastructure also is important. I think here we rely on Wi-Fi almost everywhere. Wi-Fi is slow because you're going to encrypt first. If you send Wi-Fi, everybody gets it. So you have to secure your Wi-Fi with encryption on the front end, then you transmit it and you decrypt it on the other side. That takes an enormous amount of bandwidth to complete a transaction. Fiber, one little tiny wire, of fiber can run the whole country. And yet here we are struggling with Wi-Fi, and you also have packet collisions and stuff like that. So the infrastructure, Wi-Fi is not the answer. Now, replacing fiber across the country, that would definitely make an impact as far as the throughput that you're looking at. Myself, I've been working since, let's see, I wrote my first program in 1979. So that
Wow,
kind of time.
round of applause for a pioneer.
This lady here is my wife.
Wow, round of applause for Madame. Thank you. Introduce yourself.
My name
please.
is Rose Grant.
Thank you. Thank you, Rose. Karibu, karibuni to you both. I think we can pass the mic on to...
Good morning, everyone. Yeah, my name is Dr. Ruth Mbugua, a community health specialist with lots of interest in primary health care. So I'm liking the conversation today and specifically looking at the prevention of diseases aspect, because I think our focus has been curative for too long. And it's high time that we all change our focus in line with the policies that the government has put across. We have the Primary Health Care Act. And in line with that, I work for Rose for Care Agency. It's a home care agency right across the street, opposite Sarit Center. We have a home care agency where we do provide recovery care for patients who have just received care, and also home-based care where we follow them up to the house, do a lot of wellness support, rehabilitative care. And therefore, I feel that the conversation where we just don't look at our patients as people who have to be in the hospitals, but the care they need right at their homes. So I'm happy to be here today and also to showcase what we have as an institution.
Thank you very much. And the gentleman next to you.
Hello, everybody. Yeah, my name's Kimani Wanyuike, and Dr. is my wife, and we are working for Rose for Care. Thank you.
Please, this lady is a wonderful friend of mine. She should have been on the podium yesterday when we are doing the investment track. But when you look at her, you can only see dollars. So let her have her speak.
Ero is right. We've been friends for a long, long time. My name is Irene Gathiaka, and I'm the regional director for an impact investment fund that is headquartered in the US. And what we do is we partner with people like yourselves for projects that have an impact in the human condition. So whether it's debt, whether it's structuring, whether it's advisory, that's what we've been doing across Africa. Oh, I see another friend of mine here, Dr. Lucas. And so the idea for coming today is to look at talking to some of you and getting a meeting of minds in the best way to structure financing in a way that it benefits you and it doesn't bankrupt whoever is the patient. Thank you.
Thank you very much, Irene. We missed you yesterday, but you're here today. And our entrepreneurs are still here in tow in earnest anticipation of your coming. So thank you. I think, is there anyone else we haven't recognized who came in during the speech? Come. Okay, let me take this opportunity now to bring my brother, Dr. Lucas, back to the podium. I think he may have a bit more substance than I've been able to pass on to you, but we're in this together. We're brothers in crime. Thank you.
So, this is going to be serious now. So when I teach, I am very serious. You come in late, you go back. 5 minutes, and I'll ask you questions if you're not following. Oh, no, that's rubbish. So, I'm about to get on a very technical, not necessarily technical, but just hear me out. We'll fly together. Promise you, even if there are turbulence, we are going to land in a place that you'll appreciate. So what we did this morning was very instructive. We went around and we spoke to people, and people gave their thoughts of what they thought of the conference. Then I walked out there, and then one of my friends Wangari, came to me and says, all I want to know is deliverables from this conference. To avoid this from being a talk show, like a lot of others that we've attended at some point. So I'm going to talk to you about three things. The other thing I don't do presentations. Because if I do presentations, are you reading? Are you listening? What are you doing? So just follow me, fly with me, and we'll land, I promise. And I keep on moving so that the people who are behind pillars, because they are moving, and I don't want people to have kinked necks. So when we came up with this idea, it was absolutely clear that there is a challenge. If I go around the room and ask, everybody has seen a challenge, has witnessed or family members have witnessed a challenge in healthcare, for example. I remember one time, just before I moved back to the US, I called my friend, good friend of mine who went to school together, told me, my brother has just been taken to the hospital. So I said, okay, what happened? This guy was having sepsis. He went to hospital. First of all, it took about an hour to get an ambulance to his house, where he was. Then he went to hospital 1, clearly could see it was sepsis, did not start care because they wanted a deposit, right? And then they took him from hospital 1 to hospital 2, where the patient sat there, those who understand sepsis, sat there for another hour without fluids, even fluids. They didn't even start off a line for an hour, right? So finally they did. He went into crisis. And my friend actually is a doctor too, from the US. And the doctor here didn't know that. And he's telling her, oh no, he's getting better. My friend is saying, he's flatlining, and I can see. I can see the monitor right now, this is flatline. And then that's when they realized, oh my goodness, and they pushed her out of the room. She came back 5 minutes later, or 10 minutes later, they called her in. The guy had passed. So when you look at that situation, you see the various points where care would have made a difference. And that is several people. We remember the story of the governor who was impaled and bled out. By the time he was taken to Nyeri Hospital, he pretty much was, his fate was already sealed. Okay, so project number 1, the National Challenge Program, where we want to come up with a system. We're still working on it. I could have shown it if we had it finished, where you just upload your challenge. Like now, if we look at this story I just told, there were various points when somebody would say, wait a minute, why didn't I? Why couldn't I? Why didn't we? Why do we ask for a deposit? When somebody's in crisis, why the heck do you need a deposit? Can we come up with an innovation that's going to take that away? So that when you come in, we take care of you first, and then the other things follow. So the challenge program is going to be a place where you upload your challenges. Once you upload the challenge, any university, any person will pick that challenge and develop a solution for it. Why do we do that? It's because then the solution you're creating, it is not a PhD or a master's program for posterity to look nice and to say, I have presented. No. Whatever comes out of your research is a product. Remember yesterday, Wamboi. What I didn't tell you guys is Wamboi is actually my wife, but I wasn't going to say it. Smart. I married up. So she said, if you have a solution, you will sell. That's not an issue. Are you solving a solution? Impact. Karanja, I'm seeing back there, Dr. Karanja says impact. From yesterday, right? So I tie these things. You can tell I'm a teacher. I tie things around. So That is a solution. So if you come up, if somebody has said we need this help, and then you develop something from it, now we come up with the other stuff of IP. We come up with wealth generation because that IP can actually be licensed and other things. So now you're not just doing something, you're solving a problem. So it's a system where we're going to be collating, and it doesn't matter, you just upload your thing, somebody else does whatever they need to do, and then we will come up with a way of connecting you to and to the end. So that's number one. Number two, what is the one thing that somebody mentioned yesterday? Mahesh, Professor Mahesh, mentioned something yesterday. See, I'm going to ask these questions, those who were here yesterday. Professor Mahesh mentioned something, that without funding, all this is stories, right? Beautiful stories. We can talk about whatever we're talking about, build castles in the air, which is kind of nice, because it actually builds your creativity. Build a castle as big as you want, as beautiful as you want, but that's it. Now, those who are Kikuyus, they know of something called what? Kohora mai na dere, right? You can't be doing the same silly thing, and it's not taking you anywhere. So, one of the thoughts we had, one of the ideas we had, was something we were calling the One Health Innovation Fund for Africa. That was an idea where we'll get private sector involvement in setting funds aside for innovation. And since the private sector has come in, they could have several things like fast right of refusal of whatever product comes out. There are various ways you can reward the investors, so to speak. How do you make sure that they're actually rewarded for taking a leap of faith? I stand to be corrected, but currently, Yahoo, how many know about Yahoo? Yahoo is making more money from their investment than what they are doing right now, because they invested, I think, in Google and a few others, and they're making more money from that investment. So when you invest early, because they invested early when nobody was looking, and that's when you invest early, you get the investment equity on pennies on the dollar. But when you go up, look at SpaceX. Once it's IPO, or they do the IPO, that penny becomes a couple dollars. MP Ndindi Nyoro, few years, is it last year? The year before last, bought Kenya Power shares. Who remembers what the cost was at that time when he was buying them? It was 1 shilling 40 cents. Now all y'all have smartphones. I said y'all. If you check, you'll see the price of those shares now. He bought them at $1.40. That's another thing where we need to think, institutions have to think about how to invest, and that's another way. I think the last I checked, there were 18 shillings. So for those who do math very well, if you put in 1 million shillings, what is it worth now? Times 17 times, right? Think about it. Where do you get such a return on investment? And that is what the value is in investing in a company early. So we are trying to work that out. The last system that we were coming up with, as last idea, was something we're calling the Center for One Health Research, Innovation, and Commercialization. Did you hear that? Research, innovation, and commercialization. Now that was the mother that's going to carry all these things, what comes from this college, that's the idea, whatever comes from this conference and pushes it forward. I think I had some questions about that earlier on today. So the center will make sure the investors understand what their protections are, what their duties are. The inventors understand what their protections are, their IPs, understand what that is. Today I challenged somebody and I said, how much would you sell your invention? He came up with a number. If I asked him, how did you get that number? There may not be a clear thought back there, which means next time somebody else asks you, you'll have up another number. How do you build a system that prices correctly. Remember that revenue is not profit, and profit is not revenue. When you have money in your till, you got to think about what is the cost of getting, when you have 10 shillings in your till, even in the, for the doctors who run their own programs here, they run their own clinics. When you get revenue, when money comes in, you've gotten 10,000 from a patient. What was the cost? What did it cost you to get the 10,000? How much time did you spend? How many staff members did you have? How many people touched that file? All that has to be inculcated in the calculations so that the difference between profit and revenue is clear. The fact that the money is in your till, Daddy, I need money to go to, okay, ching ching, pull out, give money. No, because you don't know what you're giving. You maybe, you could be spending your capital. So those are the things that the Center for Research, Innovation, right, and Commercialization. Why commercialization? We have a ton of very good innovations in our universities, in our institutions, that are yet to be commercialized, that are actually going to be able to make a difference and solve a problem and create an impact. Hello? Hi. Hello? You're able to create impact. So we don't think about commercialization when we come up with innovations. We always think the scientist's way. I solved a problem, I wrote a paper, it's good, it's pretty, it's here. And we stop there. That's where Dr. Karanja comes in again. So those were the 3 steps that we want to use to try and see what outcomes are from here and how they move forward. We also are trying to make sure that you don't think now. A lot of times we think now, this minute here. And part of the reason, and now this I'm going to get in trouble for this, a lot of even the political problems we're having are because we think now. We are in a political cycle, and I've always said, again, I'm not that smart, but I've always said, development in Africa needs to be decoupled from the election cycle. The issues about development, research, all those things need to have their separate track and not the political track, such that development that comes in is not caught up, it's my last year, let's dump that, where do I want to get votes from, where do we go? So that any innovation, any track that is on track just keeps on going. Now, I know that is almost like one of those things that people talk about and blah, blah, blah. I am just saying, the reason why private sector is important is that private sector is decoupled from that in the thought process. Yes, you'll be affected by the elections and by the politics, but you're not as involved in it. And that is why private sector, that's why we're important. So, to wrap this up, what did we say? How do we identify the real problems and not think now? Let's not think here. Perfect example, we were talking about data yesterday. I don't know where Joanne went. The data we are collecting now will affect how we do things in the future. Give you an example. In the US, there was a time, I think that was early 2010, 2015 there Microsoft came up with a system to use your facial recognition to open your phone. Now I think everyone just thinks that. So that time, please follow me here, Caucasian women of dark complexion. Caucasian women of dark complexion. That system failed over 55% of the time. Why does anyone think it was failing? I have not come to the Africans. I did not even talk about the Africans or the our friends from the Middle East. I'm just talking about Caucasian, white Caucasian women. Not men, women. Why do you think that was it? Why do you think that is? It's because the training data, what was used to train that system was Caucasian males between the age of 19 and 30 and Asian males, because they are the ones who are in the tech industry, and when they were trying to take pictures so that they can teach the computer, that is the face it kept on seeing. So when it was dark complexion, they were like, wait a minute, is this really the right person? And they came up, there's even something about the democratization of AI. I worry a lot. We are soon going to start getting the second generation AI equipment that is coming from the first generation from the West. Is going to be exported here as gifts. AI as gifts. When they come here, what training data does it have? It doesn't have African training data. How accurate is it going to be? Because when we start seeing AI, we are handing over a lot to AI. Look at Claude. People are not even checking what they're writing, and sometimes you get, so I was talking to some students and they sent me something, and I could tell, this is, you didn't do this, you didn't do this. And I asked a question, they forgot to read one sentence in there. That is garbage, because it does hallucination. We are relying so much on AI. And in healthcare, we're going to do that. To our peril, because our data is not in there. Yet, when we say collect data correctly, when we come and say, please, when you see a patient, collect 1, 2, 3, 4, lazima nifanye hiyo. Do I have to do that? Yes. And the better the data that comes in from our fellow physicians, from anybody who's touching a patient, the better the data, the better the outcome. And that is the thing about, I've got many patients to see. No, because those other patients, finish this. It's an extra 2 minutes, a minute, to do it right. And if you do it right, it's going to affect the future. Let's not talk about the minute now. Let's talk about what is the impact long term? And even the innovations we come up with, what is the long term? What is the long term what? Implications. That is what we need to think about. We are very now based. Relationships now. How can I get a good deal now? No, build it. Think about the next step, not this step here. This one is done. I mean, this conference is done. Now I'm thinking about what I'm going to do afterwards, because this is done, right? So longevity, that's why the three organizations we're trying to set up, the three systems we're trying to set up: the challenge collection, the funding, and the support that you need. And it's amazing how much we can do if we put things in order. Like yesterday, we talked about how many remember how many diasporas, Kenyan diasporas live out there? There was a number. Say, just yell it out. 4 million. Okay, let's do some math. 4 million. They can afford $10 a week, for sure. $40 a week, for sure. That's how much a month? $40 times 4 million, that's what? Math, quick math. $160 million. A what? A month. How much is it in 10 months? 1.6 what? They were just 10 shillings. Cynthia. So in 2 years, anyone heard of GERD? I'm not talking of GERD, the condition. Doctors are like, yeah, I know what GERD is. No, I'm not talking about the condition. The dam that was just built in Ethiopia. Ethiopia had an issue, they could not get funding. Why? Because they were blocked by another country, geopolitics. and they couldn't get any funding. Who funded that dam? The diaspora. So the dam is open with zero debt. So think about it. If we're able to agree as Kenyans we want to build Kenya, we are able to mobilize 50%. That is how much? $80 million a month. So that's what we said. No, I don't know. Every 10 months, right? No. I got lost with my math. But think about it. If we are able to raise that much, why can't we do that? Then we keep on talking about how much money we don't have. The last one I'm going to say, and please pardon me. How many people go to the US Embassy to get visas a day? What do you think? What do you reckon? 100? What is the percentage success rate? 20%? Let's go with 20%. How much is it to apply for a visa? Do they give you refunds when they don't give you a visa? So if they're 20%, 80% did not, right? How much is it to apply for a visa, roughly? Anyone knows? Let's choose 30,000. So if 80% get it, so if it's 35,000 times 100, that's what? Already. Times 100, that's 1 point. That's 3.3, that's 3 million shillings, right? Still. A day. So how much is that in 20 days? So if you do the math, in a year, how much do we give that doesn't come back to you? And yet, when you're told to invest in something that's going to help, you say, sina pesa. And you're going to go to you're trying to get to the US. So how we use our resources has to be very important. That is why we had those ways. That's why we had OHIFA, to try and bring the funds together. Talk to the diaspora if we need to. Talk to whoever it is that wants to support us. Come up with a system where, and remember this, here's another thing for medics. If you're not making profit, I know, oh, it's someone's life, or if you're not making profit, you're dying. Sustainability requires profit. You have to sell whatever your service is at slightly more than what it takes you to provide that service. Because if you don't, you're dipping into your pocket and you're going to die with it. I learned this from my wife, who once, I'm helping. She said, yeah, you keep on helping, you're going to go broke. If they pay a little more, you will help them longer and you'll help more people. And it made sense. So thinking about profit-wise, it makes a difference. So how do people benefit from that is going to be one. Two, the center will make sure that those systems work. So when I reach out, we have all your contacts. When you reach out and say, hey, this is where we're going, this is why we're doing this. And we have to pick this up. The geopolitics of Europe and the Americas are not coming our way anytime soon. Things are changing. We are moving right. We are moving internal. And then that's what you saw what happened to the USA the other day. So we should not rely. And for anybody who receives donor money here, please look at it as an investment. When you get the money, look and say, how do you stretch that money? How do you invest it so that when it dries out, you still have some more coming in? That is what COREG is supposed to do. How to guide, how to support. And I don't want to bore you anymore. So I'm done with what I was going to say. And we will reach out. If we reach out, that's what it is. Thank you very much, and thank you for listening.
A round of applause to Dr. Lucas and those wonderful pearls of wisdom. And you'll be getting more pearls of wisdom, probably a surfeit of pearls today. But let me take this opportunity now. Today's session presents an interesting convergence. Yeah, we have the several different tracks: cancer, kidney, health security, and AMR, a climate one, research and innovation, local manufacturing. But where rubber meets the road, we say, is the trade and investment track. And I want to give you, before we take a break, an opportunity to hear one or two more pitches from entrepreneurs with very, very, very good ideas. who are in the practice. They're not necessarily startups, some are upscaling. So before we do that, we often identify a financier. And we're pleased to introduce to you, once again, she had an initial introduction, but let me formally introduce to you the Regional Director of Africa Impact Finance, Irene Githiaka. Please come to the floor. Round of applause for Irene. She's very special. She was once an African diaspora. Now we have got her back into Kenya. Thank you.
Thank you. Hello, everybody. You're not hungry yet, are you? You can still wait for a little bit before you go for tea, right? So I'm the Regional Director of Total Impact Capital. And Total Impact Capital was formed by an ambassador who was the US Africa Union ambassador during the W. Bush era. And the reason he, after being an ambassador, formed Total Impact Capital is that he realized, like Errol had mentioned earlier, and even Dr. Lucas, any of what is going to succeed in Africa has to be profitable but manageable. We are not going to rely solely on grants and on social projects that don't have a profit angle to it. And so the realization was such that if you're going to make it profitable but still impact the community in a special way, you don't bankrupt the families, and you make a living out of it. You won't feel like you're wasting hours and nobody's recognizing that that's what you're doing. And also, it makes it sustainable. So he came up with Total Impact Capital. He started in Southern America. It did very well, but he always had a longing for Africa because of staying in Africa, into Ethiopia for quite a while. And that's how he got into Kenya, into Nigeria, into some projects in South Africa, and into Tanzania. So we are in several countries so far. The idea is, even if you're a startup, you come up with instruments that can allow you to go to market, maybe without needing collateral. And what that means is that you come up with a really good idea of what that looks like and how it's impacting the community. So you don't have to, have your home, for instance, as the collateral. And God forbid that anybody ever needs to call up on that, because it's not even easy liquidating and turning it into the money that you're owed. So that is never the intention. So we come up with products like going to market with commercial papers. We've done that for quite a few of our projects. And we raise money and then look for partners who can support us, like the DFIs. What you do have to do in your project plan, though, is to demonstrate the target market that is so ready to just be tapped, the geography that you're in, because you have to be going where there is a need, and consistency in your delivery, so that you're not looking for employees every single day. You're looking for a different one, and you don't have consistency, that people cannot rely on you. And two, you look for the usuals like competition. But in Africa, I feel if you're, for instance, addressing any part of healthcare, chances are you will get the kind of clients that you're looking for. Then the next question is volume, because you're not trying to bankrupt whoever is the patient. These are areas that we can explore, especially when Dr. Lucas was talking about forming these organizations. You will show the benefits once it's sorted, and then you work backwards. What does that look like when it's a success? Work backwards with the cost coming to, now let's look for funding. And that's where you go to market with a product like that. And we have been pretty successful. Anybody know of medical credit fund here? Oh, there you go. Yeah, it's very effective in loaning asset financing all startups for clinics, just on the medical side only. They are very, very good at that. And we were one of the initial people that helped set it up. And we were in the committee, the financial committee, for quite a long while. They are so big now, they can stand on their own. And we have other, we have water projects similar. Anyone know Jibu here? Jibu Water? Ah, there you go. Yeah, somebody knows. So we have projects that once you've set them up and you didn't bankrupt anybody doing it, they grow and they stand on their own, that they now move to the big leagues. They leave us behind. And we are happy when we see them graduate. So that's where you need to be thinking. Are you setting up a clinic? We are thinking of setting up a chain of clinics, if you will, and you get a clinic and you're financed and you set up, and once you become too big, you graduate to the next level. But you will see that the startup, your doctors and healthcare providers, we don't want you stressing about money if we help you plan it well. And so that to me is, let's not be thinking that I have to go grand and go so big that you can hardly manage it. It's okay to grow gradually. We help you do that, and once you have graduated to the next level, you move on to the big money, and we are left helping the ones that are doing the startups. And that way, I find it's manageable because you have levels of care at whatever level, including the very bottom of the pyramid, without someone feeling like that demonstration we just got here of somebody dying because you had to give a deposit. It gets to a place where if you have care enough of the clinics or the setups or the care homes that Rose is starting, then you have a place to start and you don't have to die because somebody waited to get a deposit out of you. I'm hoping that the good thing about you being here is that we have a meeting of minds. So all of us will be talking the same language. Now we'll be looking for the best solution. And for that, I really appreciate Aero and team for setting this up, because you remind us that whatever we are doing is needed and it's effective, and we should continue doing more of it. Again, my name is Irene, and I'm the Regional Director for Total Impact Capital. If you want to have a chat outside, let's talk further and figure out how to finance affordably. Thank you.
A big round of applause for Irene. Please, Irene, take a seat here with the microphone as we introduce a couple of entrepreneurs who felt that they had a compelling need and an obligation to make their presentation at this forum. Can I call on Dr. Billy Juguna? Is Dr. Juguna in the house? Come on, round of applause for Dr. Juguna. He's been an avid supporter of this forum. Please, you can make your pitch from here. And without further ado, he will introduce the subject matter to you. Thank you.
Good morning, everybody. It's glad to be here this morning. My name is Billy Njuguna. I specialize in what we call integrative oncology and founder of Integrative Medicine Society of Kenya and First Compounding Pharmacy. We're setting up the first compounding pharmacy in East Africa, where we have contracted 8,500 farmers in Murang'a County who are planting herb that will be extracting for various compounded molecules. I think that my pitch is already at the screen. So the First Compound Pharmacy was set up 2 years ago, and there is a need, we feel, in terms of regenerative and functional medicine in Kenya. There are those clinicians who are looking for what we call physician-grade food supplements who are practicing functional and integrative medicine. That's the market that we are targeting at this time. And also the natural health industry in this country is really picking up in a big way. And a good example I can, a small test I can give you, if you can just Google right now, how many Kenyans are looking for or integrative or functional medicine, just in your phone. We're talking about 80 to 70% of patients who are looking for these particular services. And as a first compounding pharmacy, we are able now to commercialize this industry and help to implement the TCIM policy in this country. So we need to have any questions from there. I think the page, we can go to the next page. Next page, please. So yeah, we have about 8,500 farmers in Murang'a County and in Machakos who are already growing the special herbs. One of the herbs that we are really pushing is safflower. And safflower, we are extracting a molecule called saffloramine A, which is really used for as a chemotherapeutic molecule. And so we are transforming biomass directly, in that positional facility in Murang'a County. And what we're looking for is, the domestic consumer packages, from manufacturing of phytomedical distributors within the regional healthcare within East Africa. The next, please. Our phase developing in Murang'a County, establishing a premier integrative GMP compounding and one of the things I can say is that besides that, I'm the 5th generation of traditional medicine practitioner in my family lineage, and we have about 5 compounds that have been used in my family for 5 generations for, that we have already patented and that will be part of what we'll be commercializing in the compounding pharmacy. Next page, please. So at the moment, I hold the 500 shares, which we, just from our pocket, like what Eileen was mentioning, we had to, put up a sale of a home to put up the facility. And one of our directors, Dr. Tam, who have presented the nanomolecules. Next page, please. So far, this is the historical performance of the company. Next page, please. Next page, please. So we are requesting a total package of about $12 million in growth equity, which we structured at subordinated debt phase in one phase development of facility, and the import substitution of macro impact about for 5 million, the market that Kenya have been using to importing these compounded molecules in Kenya. Next page, please. So this is the projection for the first year and the socioeconomic return on investment. Next page, please. Okay, all right. So, and we are looking for those that kind of partnership In case of any question, we are ready to share more information. Thank you. Any questions?
Taken away. Thank you very much for that pitch. Please take a seat there. Let's make sure you earn your victuals, which you'll have in the break very quickly. I have another gentleman here, another team. Just give them 5 minutes because you've pitched, and we have heard you. But I think you like the chemistry of this audience. So please come forth. Have you given your details to the tech team, or you're still delaying us? We have 2 pitches, and then we'll have question and answers. Then we can have a coffee break, a well-earned coffee break. Don't you think? Yeah. Come, my dear, you're back again. Look at her, wonderfully beautiful. Miss Morembo has ideas, and she's very passionate about her ideas. She felt yesterday she spoke to a segment of the audience. Now, today she sees different faces who she would like to know, and she would like to introduce her subject matter to. Please, the floor is yours.
5 minutes, sir? Yeah. Good morning, everyone. Yeah, as Ariel has said, Professor Ariel has said, I'm really passionate about what I'm solving currently. No wonder I'm like, if I can get really 5 minutes of your time, I'd really appreciate that. So I'll just wait for the technical team to put up the deck so I can go for.
Let us know who you are.
Okay. I am Prudence Ibila. I am the co-founder and CEO of Uzima Nexus. I'm also a student, a master's student at Kenyatta University, pursuing my master's in biomedical engineering and a medical device innovation. Okay. So what Uzima Nexus we are doing? We are currently solving for the reality of healthcare data fragmentation. So we are offering a health operating system, which is connecting the African clinics, the patients, along with their health data. So it was about 13 years ago when my aunt was moving from hospital to hospital hospital to hospital within our county. And then she finally moved to Eldoret, where she was diagnosed with cancer. This then resulted her to be referred in Nairobi for the treatment. Unfortunately, there was delay in the treatment, so we lost her. A decade later, my sister, this time a known sickler, faced the same delays, now at a top referral facility. I've lost 2 lives because the healthcare system apparently failed me. And this is not just my story, but it's the reality of so many Africans and so many Kenyans as well, especially thinking around non-communicable diseases. For example, just the first meeting that we had here with Dr. Meli, he mentioned that the rise in cancer, especially here in Africa, the African Kenyan context, we have 47,000 annually reports of new cases of cancer, and 70% of these patients actually end up losing their lives because of late diagnosis. And the reason why they lose their lives is because healthcare data is fragmented. And most especially, if you can think around the context of the rural areas, there are no health experts. There's no health experts. There's no shared records as you move along your health journey. And if even you as a patient and the new provider that you'll go to, there's no transparency in these particular records that you handle. So that is why Uzima Nexus, we're here. We're offering an all-in-one health solution. We're offering for the clinics a health information platform that stands on 4 things. So we'll ensure faster workflows through our automated systems. We also have ICD-11, assuring consistent diagnosis. We also have smart referrals inputted in our health information platform. Lastly, we are considering encryption and transparency of health information because it's really, health data is something really crucial. So we are considering encryption of the same. Now for the patients, we offer 2 things. We offer you a mobile app. The mobile app has blockchain inputted for encryption. We also have incentivization within our platform. We have accessibility in rural areas through SMS and USSD put in our platform as well. And for the second solution, for the patients, we have our wearable and smart cards. So as you move along your patient journey, in 3 simple steps, the doctor is able to make a clinical decision. So step 1, it's scanned. The card is scanned or the wearable is scanned. Step 2, you're authenticated. An OTP is shared or a PIN is shared, a PIN is put in for the doctor to access your records. Then the third step, the doctor views and updates these particular records. So where we are currently, the target market, who we are giving our solution to, is the healthcare facilities with our health information platform. And you as a patient, we're offering you our mobile app, our wearables, and our smart cards. Now, the pharmaceuticals and biomedical manufacturers are our secondary targeted clients that would benefit from anonymized health data to come up with solutions, pharmaceutical solutions, also to come up with biomedical solutions. So unlike our competitors, we have put in place blockchain for security and encryption. We have also had offline capability by having a desktop solution, a web solution for the clinics or a desktop solution for the clinics. Then we have portability of your records. As you move along your journey, you have your records with you. We also have interoperability put in place and considered, and importantly, we are also scalable in rural areas. Our competitive advantage is more like why we are, as compared to our competitors, is that we have a centralized health record system. We also have transparency put into consideration. We have security through blockchain, and we have empowered our patients through our wearables, and we are scalable as well. So currently we are earning through our clinic solution, and we have a multi-revenue streams, which we are looking to unlock through the commissions, through government contracts, through the sale of wearables, and through our on-chain transaction fees. Our market, our target, our TAM is a 1.3 trillion global digital health market, and we are looking to tap into the $110 million opportunity by entering into the East African market, entering into 2,000 clinics and input, and having also 500,000 patients within our solution. So far, we have more than 1,000 patients in our system. We have also put up 10 specialists in our solution, and we have been able to process $75K in terms of our transactions. We have also a 500 clinics waitlist, which is worth $1 million in pipeline value. Then we already have our patient prototype ready, and we are looking to validate that. In matters of our partnerships, we have a strategic partnership spanning from technology who have supported us with the technology. We also have growth partners. We have clinical partners and innovation partners as well. So our ask today to the investor is 750,000 USD as our pre-seed. We are doing our pre-seed round in order for us to achieve the milestone of distribution momentum, to also have compliance, to also have operation and customer support. This, in the end, will translate to retention. It will also translate. It will also translate to revenue. It will also translate to growth of the company. This is the team behind the solution. Myself as the CEO, a biomedical engineer. Alvin as our CTO, a software and blockchain engineer. We have also our mentor and advisor, Professor Paul from the University of Toronto. We ask that you join us to solve this solution and ensure that no African family loses their life because of broken healthcare systems. Thank you.
Thank you very much. Please have a seat on this podium because we will have further interrogation to 1 or 2 questions. Can I call on, is that Christabel and her team to come forth and make your final presentation before we go to question and answer and we take a break? You know, there was once a Greek philosopher known as Prometheus, and Prometheus was known for his great mind and thinking. I see here with these young millennials and Gen Zs that they're great thinkers. They've crafted ideas that are practical, that are innovative, and lend themselves to commercial adaptation. All our speakers so far, they're no startups, they're ongoing enterprise initiatives, and I want you to receive them, look at them carefully, and interrogate them later. Those of us with our piggy banks, start looking into that piggy bank and see where you can find money to support our young people. So let me hand you over to Christabel, who will then discuss with you. Thank you on her project.
Thank you so much, Sir Aaron. Louder, please. Thank you so much. So there's a question I asked yesterday to people who were there in the deal room, and I would like to ask it today for the sake of those people who are not there. So by show of hands, how many of you eat or enjoy eating fish? Amazing, amazing. Yeah, and did you know that only 40% of the fish is served in your plates? Did you know that? No. And where do the 60% go to? It's waste, right? And at the same time, with the medics in the house, you can confirm 60% of our brain consists of 60% fatty acids, right? Yeah, and we can boost our brains also with the use of the 60% waste from the fish. So ladies and gentlemen, my name is Christabel from Yasi Aquacycle. I'm the co-founder and production manager at TRC Aquacycle. Next slide, please. Yeah, so currently, at ERC Aquacycle, we use the waste to make fish leather and omega-3 fish oil, which here in Kenya or Africa, a number of households, they really struggle to raise money to buy such like medicine or supplements for their neurodivergent kids and family members. Yet we have the opportunity here in Kenya, we have the resources that are really potent and very readily available to make such important products. There are a lot of opportunities in the fish market. Specifically, as YRC Aquacycle, we dwell on the waste. You can see we can use fish skin to help in healing wounds. We can make collagen with them and all the products that you see here. And right now, we just using it to get the fish oil and the fish leather. We are looking forward to partnering with very interested and like-minded partners, to tap into all these opportunities. So far, and it's very confirmed that the current fish oil that is consumed here in Kenya or omega-3 supplements are imported from Europe and Asia. Yet we have the market there that we can really, when correctly supported, we can really tap into the market and improve our livelihoods. Our attraction is here, and so far we've sold over 20,000 bottles, and we are working with over 1,500 fisher folks along Lake Turkana and Kisumu County. We have so far reduced more than 30% of local dumping of the fish waste. We have also recycled over 5,000 kilograms of waste into products. Our product here is KEB certified. And as you know, Kisumu is hot and Turkana as well is hot. Lake Turkana is one of the largest desert lakes in the world. And we are trying as much as we can to be very much organic, and we are using solar power to reduce 85% power consumption per batch. Someone would ask, why YRC Aquacycle or why YRC fish oil? These are the things that makes us stand out. We are very much chemical free, and the imported omega-3 fish oil that we consume here in Kenya, they have got additives. As YRC, we want to stay and remain as natural for the potency of our product to maintain the effectiveness of our product. So we use low heat extraction process, and also there there's no day that you'll wake up and not find waste anywhere. So there will always be waste, and the opportunity will always be there. And also, maximum potency, 710 milligrams of omega-3 per 100 grams. That was tested, and that's why we were KEBS certified. So far, this is the team that we work with. Daniela as the founder of ERC Aquacycle, and as you can see, the team here is 80% women. It's a women-led organization, and I repeat louder that it's not just women, but young women that are leading this team. And our financial projection, we are hoping that by 2030, we'll be experiencing our industrial transformation and zero waste capture. By zero waste capture, I mean, we want to maximize waste as much as we can and ensure that there's no waste that goes without any kind of innovation to generate productive products that can help us, even health-wise. And so far, we've started having research and development on what to do with the fish scales. And we are focusing right now on B2B channel shift and quality premium product development and also efficiency gains. This is self-explanatory, and because of time, we sell a bottle at $12 as the total cost per bottle. Production cost is 9.90, and here is the gross profit per bottle. So far, these are the people who've believed in us, as you can see. And last month, we got onboarded on a program by Hatch Blue. We went to Dar es Salaam and we won the most scalable startup and did the best pitch. Yeah, as I conclude, our current task is 200,000 USD, where 25% will go to market expansion, expand reach into new markets, 45% will go to operational scale-up, 20% team growth, and 15% product development in 16 months. These are some of the testimonials that we've so far had. Thank you so much. ERC Aquacycle.
Come on, a big round of applause. They're doing a great job. This is not only a women-led organization, but a young women-led organization. And I think most of us grew up on what was called cod liver oil. Yeah, I think it was branded 7 C's. In our time, taste was an issue, but I understand in latter years it became flavored. Now we have our very own. We have in Africa great water bodies. In Kenya, we have Lake Victoria and other lakes, Turkana. But in Africa itself, we have one of the longest lakes and the most resourceful lake known as the River Nile. I think in recent time, it came to the attention of social media when the Israeli Prime Minister Netanyahu said it is the only place on earth where fish die of old age. Yes, so we have the natural product because the source of the Nile is Lake Victoria. So all the fish in the Nile obviously are beneficiaries of the waters of Lake Victoria. So on that note, let me just thank you for being a wonderful audience. We will continue later on with this team. Keep your thoughts because we're going to have a question and answer session. We're not going to allow them to walk away like that because we have a slot where you'll come back to the podium and you'll be interrogated by the audience. But whilst we're here, just want to take the opportunity to thank our exhibitor, Bwana Ami, and his team for the wonderful organic products on display. Here, when we changed venue, apparently the other exhibitors were not able to respond accordingly. This brother of mine is the one with the mobility, the flexibility to accompany us wherever we want to go. So as you leave this podium, please have a look at the products on show. Discuss with ABI Organics team, headed by Bwana Ami, Rakuma, and Asa, and the rest of the team, and make a purchase there, please, kindly. As you consume of your victuals, I bless you and pray that we'll be back in 20 minutes' time. Okay, can we? Let's break for a tea break. Thank you very much. Thank you for your attention this morning. Yeah, tea is already served outside. There's no who will be moderating this session. She's just taken a cue from the team that made a presentation early this morning. So while she's doing that, I think Dr. Juguna, you had made because safflower is a main botanical plant of concern, which we have been promoting in one of our diaspora organizations, the Kenya Diaspora Adaptation. Dr. Mwaniki resides in Botswana, where he practices trade and his research, but often in Kenya to share the benefit of that research with us. So just to introduce you to the crop called safflower. It is a sunflower, Kanahi is what? Safflower. Yeah? And in brief, like all plants, it has a Latin name. Can you pronounce that name? Carthamus tinctorius. Yeah? That's its Latin name. I'm sure it has a Kiswahili name by now. But it is not new to the world. It is very known to the world, and it has different applications. Yeah. So very briefly, it can be used. It has properties for extraction of edible oil, has properties, medicinal properties, and it has properties for feed ingredients for animal feed. Next slide, please. This overview, a quick overview. One, we're talking about safflower, a little bit about the agronomy. It has capability for processing. We're looking at marketing aspects, economic aspects, and probably the key takeaway. We have tried to look at this crop in terms of how it can fit into the new family of sustainable income crops in this country. So keep moving, please, quickly. Let's move on. This is a platform we've developed, and this is basically, oh, you're a bit quick. This is a platform we've developed on our devices and how to integrate this new crop into our knowledge base. So we have, on our devices, we have an app that gives information about the crop. We are, an aspect of the app also speaks to supply chain optimization. Third aspect of the app we have is on market creation and platform. Aspect now is how we have a package for financial transaction and inclusion. It means we're covering a whole ecosystem or different aspects in trying to migrate this crop into the bosom of the Kenyan farming know-how. Let's continue very quickly. We can move on. It has a history. As I mentioned, it's edible oil. It has properties for medicinal and herbal, which is what Dr. Juguna will be talking about in due course. The petals also, we told, provides the raw material for natural dyes, and it also has cellulose material that can be fed and compounded for bird and animal feed. Okay, and then obviously at the far end, we have the cosmetic aspects and the natural oil, essential oil aspects. So the supply chain and the use and utilization to which this crop can be put. So lends itself, right, the various marketing channels. Our preferred marketing organization is through the cooperative system, through the farmer groups which we have. We will grow and we'll market at the farm gate and we'll process through a cooperative system. That is our preferred system. Its use of herbicides and pesticides will be limited, so it will, at the end of the day, be an organically grown crop. Can we move on? This is where rubber meets the road now. The global market of safflower is $1.5 billion. It evidences a 4.2 compounded annual growth rate, and annual production in the world is 700 metric tons. The rate of return, the gross margins on this crop is something like $2,500 per hectare. Yeah, so it's part of a new family that we're introducing into Kenya. It is, I highlighted this because it is a product of Dr. Mwaniki, who lives in Botswana, a Kenyan, and he's been working with Dr. Juguna and other experts in propagating this material here. So that's just to confirm that Dr. Juguna has a case with his project. So let's move on. I think, Dr. Robert, you, again, we want to give you your 5 minutes. You've been very good with us, and you're able to use your slides and give us a presentation for 5 minutes. Thank you. This is Dr. Robert Karanja. He's a friend of KUKA and an avid entrepreneur. Thank you.
Good morning again. My name is Robert Karanja, indeed, and delighted to speak again. I know I always stand up here and I tell you about genomics. I want to do a little bit different. I want to do a bit of a pitch, some of it for money, because I think I'd love to partner with you, but also for your partnership, because what we're building at BioLinks is actually a platform for R&D and innovation. And if we could get our slides up, which I think I shared yesterday. Oh, there we go. So this is an East African biopharma platform. One of the big things that I think is shaking the world all over the place is the fact that AI and machine learning has really started to mature. What that means is that stuff that I used to dream of when I was doing my postgraduate, maybe 15, 20 years ago, I can now do seated on my computer. Today we have an Ebola outbreak that's knocking on our doors. And believe you me, it's possible to design the vaccine for that within 24 hours. We were to do a hackathon today. The question is, can we do it? And how do we set up a platform that can address our issues? So BioLinks is helping us to do that by integrating several things. The first one is a venture studio. I do operate as an investor, so I provide the seed capital, I provide the infrastructure for you to do the science, and we invent together and we commercialize together. Second part of it is the platform. It's a genomics platform. Why? Because we're in East Africa, and East Africa is also the home of humanity. This is where the highest genetic diversity happens to be in terms of the human race. We also speak to clinical trials and data repository, because again, AI and machine learning is all about data. If you don't have the input, you can't do it. Let's go. So how do we integrate it? Oh, that wasn't what I was looking for. Next one. I think there's a challenge somewhere. Yeah, just skip. Yeah. So we basically exist to do two things. One, we exist as a private sector consortium. So as you notice, I'm doing a lot of things. So it's not all under one company. We manage risk by having separate companies working together. And that is really just to promote innovation, to de-risk R&D and accelerate innovation for academia and for industry. So we're building a plug-and-play platform that allows you to come into an ecosystem that is already set up for you. Next slide. So what do? We have our R&D partners, and I believe that is all of you here. And if you're not, please, let's talk, because I want to convince you why you should partner with us. So you come in, and what are your needs? You're thinking, I want to do some discovery R&D, I want to do some clinical development, and I want to achieve market access. So when you come to us, what we offer is what we are calling the ecosystem as a service. So this basically means we have our genomics and lab stack, where we have next generation sequencing, high performance compute, and precision medicine capacity all seated there. So you don't go out, it's all within one roof. We also have a clinical trials platform that allows you to talk to other clinical trial sites in Kenya, across Africa, that we're engaging with. We've gone ahead of you, we've prepped to understand, can they support what kind of studies? And we're able to give you the information for you to design your studies. We're also able to do IP and venture creation. As I said, I'm here for health solutions from academia and from industry. So we can invent, we can discover biomarkers, we can develop them, and we can be able to create biotech startups. And the last part is data and insights. Everything, as we talked about, whether it is, one of the things that we want to do is to set up a federated analytics platform that allows our genomic database to also interact with other databases across Kenya, across the continent, and even internationally, because nowadays it's easier to send my algorithm to you than us sending data back and forth. So it also means that we can speak to data sovereignty, we can speak to all issues of privacy and ethical access without, and still be able to get the insights that we want, whether it's for commercialization or for discovery. Next slide. So how we set up, as I said, we are a consortium. It's a whole family of companies. On the lab stack, we have NextGen Molecular Lab. We're on Limuru Road, Rosalind Riviera Mall. TAGCC, the African Genomics Center and Consultancy. This is our oldest company. We've been around here since 2015, doing all sorts of stuff from bioinformatics, NGS, as a contract research organization. We have Clinia Research, also set up in 2015. This is a CRO that's based in Mauritius and in Paris. Again, we've been working across Europe and working in Africa. And the greenfield for me is Viwingu. So Viwingu is a federated analytics platform. So that one is a startup, like proper startup that we're basically fundraising for to leverage and connect our genomic database. Next slide. So in terms of the capacity we have when you come to NextGen and TAGCC, this is what you get. We have everything from the ISEC, the smallest platform for NGS, to the Novasec X Plus. So there's no capacity of work that we cannot do. We have over 5 petabytes of high-performance computing and multiple GPUs in there for top-notch analytics, so that when we're talking about designing and discovery, we're able to actually do it here. We're not struggling in terms of computing power. Next slide. This is just a very crowded slide, but basically it's just to say, as Clinia, we have about 10 years of experience working in UK, in EU, in Mauritius, in Reunion Island, in Nigeria, and now we are setting up a base here in Kenya, and we're actually mobilizing about a million euros to scale operations for Kenya and East Africa. Next slide. And Viwingu is what I was talking about in terms of how do we do federated analytics. And my vision here is very simple. We all know everybody's talking about big databases and all that. My big issue is always, do we have the power? And how do we work around that? We basically are looking at Edge Cloud as a particular strategy. We want to encourage as many research institutions and universities to actually set up their databases that we can then, how do you call it, network among ourselves, so that you own your data, you're in charge of it, you know what's happening to your data. When I send my algorithm to you, you can actually see what I'm doing with your data. And the best part of that is that as we do work together, we generate revenues, it's very easy to do revenue share, and it's also very easy to be able to see the value that is being created with your data, as opposed to those big data centers that everybody's talking about. So how do we go nimble? How do we go frugal? But how do we innovate smart? Next slide. So when you talk about, as a venture studio, how do we really operate? So the equipment we have is very expensive. It's a regulated space. So we don't just allow anybody in. We come in and we have to train, we have to vet and assess who we're bringing in. So we do that through our in-residence program. So we put out a call. So for example, last year we had put out a call across East Africa, EAC, and it was only because we were doing it for the first time. We put it out for 1 month, and we received about 25 applications from Kenya, Uganda, Tanzania, Rwanda, and I believe we also got some from the UK. We got some diaspora, Kenyan diaspora in the UK who applied. And out of them, we selected 3 top ideas that we invested in, brought them into our lab, started off with everybody. It's your concept level, you are working in our labs, and we see what you're gonna get. And ultimately, so some of them fell out of the 25, so you get a bit of attrition. So there are those that come in, and then eventually they do the research. Do we get a scientific proof of concept? Yes, no. The ones that we do, then now, is there commercial viability? Yes, no. If it's yes, we proceed now as an investor, and we're putting in money, and now we're setting up a biotech startup in the UK to commercialize our liquid biopsy for prostate cancer. And this is something that anybody who's interested in whatever focus area, we can do this for infectious diseases, we can do this for NCDs, we can do this for mental health. Again, what we have and what we can offer to the world more than anybody, better than anybody else, is the genetic diversity we have in our population. And what that basically means is tons of undiscovered SNPs, tons of undiscovered genetic variants that can be harnessed towards generating new drugs, vaccines, or diagnostics. And that's our approach to doing it. So we operate both in Kenya and in UK. And people ask me why in UK, and I say, to be honest, we have a lot of work to do to build up our ecosystem. And I don't want to be 80 years old for this ecosystem to be mature. I want to start now, and so I partner with where the capacity also exists. And also the other side of it is we create a win-win, because as we speak now, most of the capital that is coming to Kenya is coming from the global north. So how can we also ensure that it's a win-win for all of us? So we build ventures here and we build ventures there, and the R&D is happening across. Next slide. So if you're asking what kind of stuff can we do for you, or what are the problems we're really solving, I always tell startups to start with the problem slide. We're addressing a fragmented research landscape, regulatory uncertainty, data sovereignty issues, limited African representation, limited African DNA or genetic data representation in R&D, and high reputational risk. And that's what locks a lot of the big pharma and other people from solving problems for us. What ultimately this means is that in another 10, 15 years, we'll be seeing drugs coming to market, and they're prescribed against women, pregnant mothers, children under 5, and people of color. What can we do to avoid that future? and I think our platform is trying to address each of those in the ways I've prescribed there. Next slide. In terms of examples, to be more practical, you can be developing a vaccine and you want us to validate your T-cell epitope against our genomic database. That's something that we can be able to do. You could be looking for, I need to start up a clinical trial, first in human or something. Where do I start? We can help you think that through. You may be thinking discovery R&D. How can I discover conserved antigens from African pathogen genomic data? We have a ton of pathogen genomic data. Again, we've been working in this space for the last 10 years and being able to, of course, work in a GDPR compliant setup. Last slide, I think. So why should we partner? Because I think this is what we can do. We can develop talent and venture development here for both Kenya and for UK. We can build an amazing innovation ecosystem that I believe would be second to none. And last one is a massive innovation pipeline. Because again, our biggest edge in terms of our competitive edge as a region, as a country, is our genomic DNA. If we don't manage it, if we don't build an ecosystem to harness it, two things can happen. One is biopiracy. We get it spirited away, and then we lose out on any value chain that we can create here. The second one is the worst one, zero-sum game. It's called a dog in the manger. I can't eat hay, but I won't allow the cows to eat hay either. Total loss. Let's avoid that. Next slide. So that's the team, massive team, lots of experience, both in science, in investment, and in innovation. Next slide. We have an amazing advisory board, including from one of my good friends, Professor Mehdi from Innovation UK, and a bit of industry representation, and KEMRI, of course. Next slide. And a massive ask, basically, for different people. For those who can invest in us, we want to get some, we need a lot more money. We're not speaking of CapEx at this point. We need more OpEx and more like fund of fund kind of partnership. We're also looking for some seed capital, for example, for the Biwingu, Federated Analytics, and so on and so forth. But more importantly, we want people who can patronize this platform. We want to invite our academia, we want to invite the UK academia, even the biotech startups that we have, all of you amazing scientists, please don't let your ideas die. Give us a shot and let's see what we can do together. Thank you so much.
Thank you. Round of applause for Dr. Robert Karanja. Thank you. Come on, there's a lot of substance in there. A lot of work has been done. And I do hope we're delivering on our mandate. I don't know, our friends from the UK, we are the home, original home of civilization. And Dr. Robert has made the point very clear that the genetic material is here in Kenya. It is not diluted, it's highly concentrated, and it needs further exploration. So we've been dealing with matters of cancer. We've been looking at the curative side, and we've gone intensively over the past 2 days on the curative aspect. We also mooted the idea now of putting into place systems which speak to preventive, prevention of cancer, prevention of carcinogenics getting into the food chain, which we're consuming on a daily basis. And to speak to that very briefly, Ami, you only have 5 minutes, please. I know you're a musician. You're long-winded at times with your high notes, but you have 5 minutes to just once again present yourself here and tell them about the wonderful project which you have started in Limuru and which we want to know. 5 minutes.
Thank you. Good afternoon, everyone. A pleasure to be here. Once again, my name is Ami, also known as the Veggie Man in the music industry. I make a lot of noise about organic agriculture, sustainable living, and returning to living in harmony with the earth. One thing I'd like to say, and I'm going to be as brief as possible, is that, and I say this to all my students, every single class, we're not here to teach you about just growing food organically. What we're doing is repositioning you back into being in your position in the natural ecology of the earth as it's originally designed by the Creator. So we're repositioning you to function as a student, one who is designed that your responsibility is to be a guardian of creation. So we're repositioning you once again. So all of our objectives, the biggest returns in what we do is healthy people. We have addressed so many situations here, and we know constantly what we look at is the problem, and we put patches on the problem. You know, we have a lot of bandages, and too many times we're seeing a lot of what we think are solutions are really bandages. We're saying, let's get to the root cause. What's the root cause of some of the cancers? What are the root cause of some of the kidney failures? What are the root cause of some of the diseases and some of the non-communicable diseases we're talking about? A lot of it is lifestyle, dietary choices, habits, and many times we have been following the directions of those who want to sell you products, especially in the agriculture space. In the agriculture space, too many of these chemicals we're using right here today are carcinogenic and deadly. And we continue to do the same thing, expecting to get a different result. So with our trainings and what we're doing, we're constantly pushing this initiative that we have to return to the ancient wisdom. So part of our projects, we do greenhouses, we do irrigation systems, we train our farmers in different modalities of production, but what we teach them is using modern technology with ancient wisdom. So we're using the wisdom of the ancients where we are regenerating the soil, where we are focused on controlling insects and diseases naturally with no toxins in the body. So what we have started in Limuru is one of our training centers where we have actually developed, we've made some good strides and started training. Although we didn't have everything we needed, we started anyway. And what we're looking at is a training center where we're doing several things. We're training the farmers, empowering them so they have marketable skills, that they have the knowledge to go on and develop for themselves. But we're also teaching them value additions. So we're setting up a lab where we make our own organic products. We're setting up our value addition processing plant where we're processing herbs and natural products so that we can move it. We can move from talking about what we need to do or talking about the problem and begin to activate in being solution-oriented, preventable-oriented, regenerative-oriented. So that's our position. So our project, we don't have, I'm not using the slides today with 5 minutes, and I think I've gone about 3. So what we're looking at a project that needs something as simple as $170,000 just to have the basic setup. The project with everything we need will cost $500,000, but the returns, because this is a one-time investment. We're not looking to make it that we need funding every year. The returns on the trainings alone, we're looking at approximately $50,000 to $75,000 a year. In the inputs and productions, we're looking at between $400,000 to $600,000 in a year. And the inputs on the value-added products and the export requests, which we already have people in place. We just need to have the facilities to manufacture. We're looking at a return of approximately $700,000 a year. And these are real numbers. So we're looking at something, and the profit margins we're looking at from what we need, starting capital, and what we need as operational costs. We're still looking at a profit margin where we can use to develop and to serve the people better. We're looking at approximately, we're doing this the right way, we're still looking at about a 30% profit margin. So this is what we're looking at and what we need to do. We have run programs before in West Africa, in Ghana. We had one called Regen, which is a regenerative health program, where we focus on pre- and postnatal care to child and mother's health. And we ran this program nationally across Ghana. And we had significant results. The program, and when the government changed, they still continue to use portions of this program to continue to push the national agenda. So we have seen a decrease in diseases and the non-communicable diseases. So what we're saying to you, my people, is that we need to take responsibility. We need to take responsibility for our own health. We need to take responsibility for these lands. Because if our parents had not done this organically and done it naturally from Kitambo, from way back when, we would not have been here today. And when we look at the massive destruction and the degradation of our soils, of our environments, and now the people, you, the biggest resource, life expectancy dropping rapidly. If you don't do anything now, we won't have a future. We wouldn't have generations to talk about us. It will be maybe a few archaeological dinosaurs looking and scratching some stupid people. They say these skeletons represented the most stupid people in human history. They look at the cell phone messages, they say, okay, these people were distracted. They didn't focus on anything life-giving. So, I mean, it's funny, but it's not so funny, because we are slowly becoming an endangered species, people. Human beings are slowly becoming an endangered species. So we have to take responsibility and use our God sense again. Our God sense tell us we have to change what we're eating. We have to change what we're doing. We have to change how we're farming. We have to change our processing methods, even in this medical space. And I'll close with this. If we can go forward to say, is it possible to make, and I'm talking about pharmaceutical medicines now, is it possible to make something that is going to help you with this cancer case or help you with that kidney case and not have a crazy side effect? Because I've been there. I've had TB, I've had malaria, I've had it. So I'm saying, no, can we now move to the natural? Let's go towards natural processes. Okay, so let's move to the natural way. Let's preserve our health. Let's look at regeneration. Let's look and focus at doing things God's way. Thank you.
Take a seat here. Yeah. I think, Irene, let him have your seat and you come and join me at the podium. Thank you. A round of applause for our very passionate, this is the preventive side we've been talking about. So now my role as a matchmaker now comes to culmination as I request Irene in just a couple of minutes, because we have to close off the forum because of time constraints. So we give you maybe 8 minutes to interrogate some of these opportunities that are there, and maybe 2 minutes from the floor for questions. So you divide your time 4-4. Thank you. Thank you. 4-4.
Thank you again. My name is Irene Gatiaka. I work for Total Impact Capital. And we'll get right into it because we don't have much time. And I'll actually start with you. You just left the podium. I was looking at the investment proposal that you have for Rabaka that's looking perhaps to go into business with you. What does that look like? Because you said the real numbers were something like?
The real numbers?
The total,
total
yeah.
$500,000.
That's the ask.
That's the ask.
Yeah, but if you give it a projection that if it's done right, you had
170,000 to get the basic infrastructure set up.
yeah,
Uh-huh.
and the revenue out of all of that at the end of the cycle of investment.
At the end of the cycle of investment within the first year, we're looking at approximately within the first year, we're looking at the returns. This is the whole returns.
Yes.
Of about $1.3 million.
So you're saying that $1.3 million is for the first year?
Yeah.
And the cycle continues
cycle
for the next
continues to grow.
Continues.
Yeah.
That's really good. Thank you. I was paying attention.
Okay.
So I wanted to know the cycle of investment. And what you're saying to us is that if we invest in the first year, if you feel like we don't want to roll over the investment, we can get our money back within, or maybe half of it within the first year.
Maybe half of it,
Yeah,
because
but that's okay. That it means that we have real returns that will allow the business to carry on within the first year. I hope you're following my thinking, right? That's even people in the room, while you're thinking what to do, bigger picture, you can put money in his project. I'll come back to you again. Every project has faces, and everyone is looking at you here and thinking, he's talking really a grand picture. That's where we aim to be, to get to. But can you, at least the inception part of it in Kenya, because you're already going, how do you see the first phase, second phase, third phase going?
Great. So what we're trying to do is, if I can paint the picture,
yeah.
we want to be able to do a lot of genome sequencing. We've never had the capacity for doing the human whole genome sequencing in Kenya until now. And we have partners that have partnered with us with several biobanks. I think in terms of pipeline revenue, close to $8 million.
Yeah.
And out of that data, being able to then have that data utilized in multiple ways. One of the big ways we'd love to do it is, of course, precision medicine. How do we advance precision medicine and its adoption and scaling in Kenya and the region? I think one of the easiest ways is probably to get partners in the health facilities that can make Kenya a destination for medical tourism. Simply because what we're offering, I know you can't get it within East Africa, for example.
So at the moment, you think you're the only providers of
No, I know we are. I'm not,
Yes.
let me put it this way.
Yes.
For the next-gen sequencing platform, the NovaSeq X, that's $1.2 million for that one particular machine. And that doesn't run alone. You need to have a whole lab infrastructure set up
to make it work.
Oh, boy. So the barrier of entry is actually extremely high. And that's what I'm saying. We are the first. I know we are the first. And the second thing is, as we're doing that, all this data is seated there. So why not?
So it's readily available.
It will be readily
Make
available,
use of it.
Make use of it. And that's what I'm saying. Can we have, through our in-residence program, people with bright ideas coming in, leveraging this data to do their discovery R&D? Because then we can come up with a lot of solutions for us and for the world.
Okay.
And appreciating the fact that this is, when talking of drugs and vaccines, the timeline is, you're talking, 5, 10 years, maybe even more, by the time you finish clinical trials and get market approval. So the investment climate for that, you need to operate in Europe or North America, where the financial sector actually can tolerate that level of risk. So it's very high risk, it's very high capex. And for that reason, we are working across, that's why I said for the venture building. So my vision is in the next 5 years, we should have invested in about 15 ideas. At least 5 of them ideally should be viable companies that would go on to raise Series A, B, C, and so on.
Okay, perfect. But you've answered my question, because the first place of contact is using your platform. We have all this data, so let's go in there and start playing around with it, right?
Yes, exactly.
Thank you. say your name again, because I know people have forgotten since yesterday, and what it is you're doing, and I'll have my question for you.
So my name is Utin Ezekiel. Ezekiel is a master's student of our university. We have developed a low-cost digital microscopy for accessible cancer and malaria diagnosis.
Thank you. So what I'm hearing here is that we don't have to wait forever to get our results.
Yes.
That we can quickly get the diagnosis, and it's inputted into a computer, and then somebody, your doctor, even if he's not in the room, he can access it and diagnose you from there.
Yeah, because the digital microscope, once a slide that we prepare in the lab by histologist, the slide will be imaged, change of digital directive, take it to the AI for detection. The AI will be able to detect or draw the bounding box on the suspected region, then upload to a cloud platform. So this cloud platform now we invite the pathologist.
Yes.
Now so that they can remotely, we invite them remotely, so they review these images and validate. So by doing so, we'll change the turnaround time, make it accessible, and also cost effective.
Very, and it takes me back to, I found Dr. Amit Thakur here when he was saying that part of the cost of medical tourism, a huge part of it is traveling. And what you're saying now is that we can at least cut that by quite a fraction of it. And then the next thing is it affordable?
Yes, the microscope is affordable because the part is made from the printed part of 3D technology, whereby we use the PLA material to redesign, and then we print the body part. So then we acquire the electrical component to make it full. That is to say, the microscope is very cheap, and the cost of the production of one microscope for the fabrication, not selling, is only 30,000 shillings for what we have done.
Compare that to the current way we are doing it. The microscope now is how much?
Yeah, we can compare to the conventional the optical microscopy.
Yeah.
It costs around 100 to 150. That is the just conventional microscopy. But because our microscope is also a scanner, because it's able to digitize the image, the cost of a scanner right now range from 500,000 to 1 million, which is very expensive, and some resource, the some hospital cannot able to get that.
Exactly.
Yeah.
Yeah. And remembering that that's not even part of the treatment; it's simply diagnosis. So we don't want such costs. Thank you so much. I'll go to you quickly. We are looking at simplifying the way we are doing things here. I want you to talk to me from a cost perspective. The conventional way of treating and your way of treating, doing the herbal. At the very least, even if you're not looking at anything else, you're saying it's affordable, right?
Well, I think, yes, it's really affordable. And part of what fast compounding will be doing, we are doing is to eliminate polypharmacy.
Yeah.
For example, you have a patient that, a cancer patient that you have go through maybe to use cisplatin, for example, and the active compounds in that particular molecule is allergic to the patient. So a compounding pharmacy will be able to help to compound that active molecule without the side effects, to remove the side effects of that particular patient or that particular molecule. Yeah. So that's the benefit of compounding pharmacy, and then it helps to reduce the side effect of the patient, and also the dosage of the dosage to help the prognosis of the particular molecule you're using.
Okay.
Yeah.
I'll just ask one more question. What we find is that we were just discussing this outside. Some medicine is basically made for us to be dependent on it, and you're never cured, really. Mm-hmm. And you're walking away from that, right?
Yes, exactly.
Yeah. So thank you very much. Now we know where we can get in touch with you. Thank you. I liked your presentation, and I like the fact that it's young women doing it. In terms of going bigger and going into the region in a way that is cost effective, I didn't quite see the emphasis on that. Have you thought about it?
Thank you so much, Irene, for the question. I must say the vision actually of Uzima Nexus is we're looking towards a future of connected healthcare.
Yeah.
Where once we connect healthcare, it means that clinical decisions will be made faster, and you as a patient will have a better patient journey. So as we look into our SOM, which is $110 million,
Yes.
we are speaking towards where did the problem first come in. For our case, we started with Kenya. We are starting with Kenya. And then when you're able to hit home and gain the trust, then we'll look into going to East Africa. We are going to go to Uganda, Tanzania, and Rwanda. Once we've hit home, once we've gotten the compliance, once we've also been able to connect the healthcare and find our solution, solving the problems that are actually there.
Yeah.
So our roadmap is first hitting the market in Kenya. Then as that is put in place, then we can go ahead and enter into the other markets. Yeah, so that is the focus that we have.
Perfect. Thank you so much. The reason I'm rushing through all of you is because we don't have much time. So the last one was about the fish. I loved that. I love fish, and it's sad that we waste much of it. So the next I'm going to ask is, why has it taken this long for anybody to even give it a thought? Because it seems like that's a raw materials literally sitting just right there and nobody's thinking about it. And your way of doing it, does it reduce cost sustainably in a way that if I buy the supplements today, you won't run out and I have to now start looking for plan B later on?
First, I think the reason as to why it has taken that long is because of the government doesn't really believe in young people who are trying to do something.
You just said that.
Yes.
Okay.
Yeah, so even just an example of us, because we are practically doing it here in Kenya, is when we first started with the R&Ds, we knocked doors, and obviously most of the doors were not opened because people are like, why you? If we invest in this kind of research, maybe you young girls, maybe you are planning to eat the money, or you are not going to get that serious with what the platform we are going to offer. So I believe that people who maybe at some point they tried, but they gave up because of the many no's.
Okay.
Yeah, so unlike us, we kept knocking and using what we already had for research and development.
Okay.
And we also thank Kirby for that because it also held our hands at some point. Yes.
Thank you. So I was asking, do you believe in it to be really sustainable? That if we, you don't want to keep changing supplements and going to whatever brand. So would you say it's sustainable in a way that it goes to mass market in a good supply manner?
Yeah, we really believe in it because waste will always be there.
Yeah.
There is waste all over.
Yeah, and there will always be fish, right?
Yes. And maybe just before I return the microphone, we all know here in Kenya, it's always been said, oh, people from the lake, they are very intelligent and all that. You've all heard that kind of statement, right?
And you're going to own it, right? Yeah.
Yes, because they consume a lot of fish and we get omega-3 from fish.
Yeah.
So really it's sustainable.
Yeah. Okay, and it works in your favor. It's self-evident, right?
It works.
Yeah. Thank you so much. This has been a good session, a short one. So I'll fine you for making me do a short session. So there's a question. Yeah. Yeah.
And for all of you, and this is a general question, one of the biggest problems that you have in development is validation. Okay? Have you all gone through the validation, like in Kenya and internationally, like ISO and everything? And for you, for example, we have graduate students who like to do pharmacogenomics, who like to do pharmacokinetics, who like to do HPLC and everything. And A, you have not advertised. Two, we need to have validation. And once you have validation, you can do even where I come from in Eldoret, there are issues with drugs and athletics and doping. We have students, even police for DNA compatibility, for sickle cell tests, etc. So are all of you validated with the regular bodies?
We are a category F lab under KMLTTP, so and compliant with everything.
Yes, we have. Yeah, Fast Compounding is free licensed as validated. Sorry.
Yes, we are validated data processors, data controllers. Thank you.
Yes, you are validated, KEB certified too.
Yes, we are validated, 13 years in the industry.
So that means, from what I can see, I'm being told that we have run out of time. So it will be me handing over to you, and I'll fine you both for making me talk for.
Now, thank you. Let's give a big round of applause for Irene, wonderful moderation skill, and the panelists who are here. They have wonderful, wonderful ideas, and we'll have time during the lunch break to match make and interrogate further. So without further ado, let me hand over to my co-MC and moderator, Dr. Lucas. Thank you.
So, what can I say? That was cool, wasn't it? Unfortunately, there's no time. I mean, time always. You're always chasing time. A few folks were looking at me like, I need to catch my flight. You know, when I was growing up a few years ago, that was not a thing we used to say here. Catching flights was not a thing. But nowadays, you catch flight to the West and to Mombasa very easily. So, we've come to the end of this amazing show. It's a bittersweet because we've worked so hard, we're here, we've learned so much, and yet we're now getting warm. Because sometimes the first 2 days of a conference, people are still trying to get warm. Now we've gotten where we are enjoying, we are having this pull and, conversations. I think today I've been asked for about 5 or 6 times, can you introduce me to? Can you introduce me to? So I like that. There's a lot of interactions going on. So we are going to start the closing ceremony. I'm going to introduce you to a person. Dr. Bai, please come. I think he wasn't able to make it the last 2 days, so you'll say hello, where you do, and then maybe, I don't know, maybe a couple minutes, say something 1, 2, 3, and I'll stand next to you if you don't know anybody. Thank you.
Thank you, Doc. Good afternoon, colleagues. My name is Joseph Mbai. I'm the team leader at health sector at Equity Bank Kenya Limited, in charge of health financing. I team lead the processes of financing anyone who is in the health business and would want to maybe expand a hospital, open a pharmacy, open a clinic, whether it is human resource for health that want support. That is what I spearhead. I stand in front of you to tell you confidently that if you are looking for finances, don't look further. At Equity Bank Kenya Limited, we have a team called the Health Sector Team that has people who are players in the industry, who have worked in the industry for many years. We have medical doctors, we have pharmacists, we have nurses who understand the landscape of the health sector. And I know when you talk about manufacturing, when you talk about scaling up, when you talk about good patient outcomes, you need financing. And as a bank, we have positioned ourselves strategically to make that happen. And we are committed. And I can say confidently again that we are the only bank that is also playing in the health sector. We have Equity Afya clinics, 163 right now and counting. We've started another model for Equity Afya pharmacy, which will be community pharmacy. And we are financing medical equipment and considering them as collateral as well. So if you are a gynecologist and you want to buy a ultrasound machine, you don't need to give me a logbook or a title deed. I will consider that equipment as the collateral itself. And second, and finally, I'm also proud because I found my friend here, the gentleman who was talking about the genetic sequencer. He went around looking for somebody who would believe in him in terms of financing. And we believed in him.
That's true.
And we walked that journey together. This afternoon, we are commissioning that equipment. It's a game changer. For us as a bank, we are proud for that because we have changed a story in this region. Such an equipment, most likely, you will find it in either South Africa or Egypt. So the people who are here in between now, they have him to support.
Absolutely, that's actually very
And
true.
when we talk about precision medicine, one of the challenges we have in the pharmacy area, because that's where I am, is AMR, antimicrobial resistance. That equipment, Doc, how I wish it can help to isolate those DNAs of those bacteria and viruses to actually tell Kenyans, why are we getting resistance to the molecules that we trusted most? And I know it can do that. So it's a game changer, and we are happy to be part of the story. Thank you very much.
How I wish you were here yesterday to have a full time to speak about this. Because when you're not, yesterday you'd have given you a lot of time. But that's okay, we'll give you time again. So we have come to the end, and we're going to start our shutting down, our shut eye, and our closing ceremony. And it was the Ministry of Education. It's going to be represented by my good friend and faculty from Egerton University, Dr. Otara. You'll come in and help us close this session. And Dr. Mbai is right. They believed in Robert and the team. They did, sorry. You see, I'm in a hurry because people with their eyes. Okay, so first of all, I skipped a step. I skipped a step. I want to give a good vote of thanks for everybody who's been part of this, from the Secretariat to the folks we wrote letters to, the people who wrote the letters, people who called, people who, I mean, any part you played. I personally truly appreciate that, and the team does, and everybody else who's here has appreciated your part. There are folks who are talking wee hours. Some people are sending information and nobody can reply because we're too busy. I remember Robert sent me several messages and I wasn't replying, but he knew I was busy or something. But then we met and talked. I would like to invite the British High Commission. You have no idea how helpful they've been to this. They've been very helpful. The Ministry of Health, very helpful. Ministry of Industry, very helpful. Trade and Industry. Science, Research and Innovation, excellent. They supported us. Actually, you guys had the video from Professor Shalkwat. And many others. I'm sure I'm leaving one or two somewhere, and don't kill me for that. It's just that I didn't write it down. I could remember everybody. So I'm going to invite a representative of a British High Commission to come in first, after which Dr. Otara will come up. So who's coming?
Hi, everyone. Probably good afternoon. Probably everyone's tired. I hope this session has been informative, exciting, and it's lunchtime, and I see the room much fuller than the morning. But thank you. Colleagues, partners, and new relationships. As we bring this conference to a close, I want to begin with a simple word: thank you. Thank you to our hosts for their leadership, collaboration, and hospitality. And good luck to the second leg in the UK. And thank you to everyone here across government, healthcare, research, and innovation for the energy, insight, and openness that you have brought through these discussions. In health, no country goes alone. No system thrives in isolation, and no innovation reaches its full impact unless it's shared, adopted, and owned together. The UK-Kenya Health Partnership shows us what together really means. 1, mutual respect, not one-way solutions. 2, shared learnings, not parallel efforts. And 3, long-term commitments, not short-term wins. As the UK government, we remain committed to supporting this journey, continuing to convene, to connect, and to champion this partnership. Together, we're just not shaping the future of health. We're shaping a future that reaches further forever and everyone. Thank you.
Professor Richard Cohen, are you here? Professor Richard Cohen. I'm going to invite Kerry to come and give thank you for the British team, the team that came from the UK. Is that okay? Kerry is part Kenyan. She's always here. So.
Thank you very much, and thank you to the organisers for their incredible hard work and for bringing us together over the last 3 days. I've been working in Kenya for over 17 years, and it's fascinating to see how things have developed from the original kind of NGO concept through now to partnerships between universities and innovation, people coming together. It's very clear, I endorse the other remarks, that we must work together to really capitalize on everybody's efforts together. And I would say the innovations are fantastic. I had a role in the National Health Service, not only as an anesthesiologist, but to promote innovation. So I'm very in favor of innovation. I would also say, let's look to improve what we're doing now. So it's really important that both of those things will save lives, but we must work together to look at where we are now and put in strategies in place to do that. Thank you very much to all of you. I think on behalf of the UK team for bringing us together, and we look forward to many more opportunities to work together in the future. Thank you very much.
Thank you, and I think, have I forgotten it? Because I've been forgetting things. Have I forgotten anything else? Oh yeah, I thank the Secretariat. So I say the Secretariat and what we did as a Secretariat, the Secretariat team, all the folks you've been seeing running around. We have the camera folks, the IV or audiovisual team. We have the team out there and the Professor Dixon out there who are making sure that you have your lanyards and you're good and happy. We have the hotel that was putting food together. I mean, nobody has been running to the bathroom, so I think everyone is okay. So the food is good. It's funny, I was at a conference where they actually served us bad food and people actually literally were going. It was crazy, but this didn't happen. Everyone is happy. I can see everyone smiling. What else can I say? The smiles make me happy. The interactions make me happy. The new ideas make me just ecstatic. And we have a lot here. There's a lot we can do, and there's a lot that we can achieve together. So I'm going to invite, I think this is right now, Dr. Otara to come and close it for us. Thank you.
Thank you. It's a bit overwhelming to step into this space. As introduced, my name is Otara. I work at Egerton University, School of Medicine, Faculty of Health Sciences. I'm a professor in reproductive health. And I came to this conference to represent my Vice Chancellor, Professor James Kibwage, who himself is a renowned scholar in pharmacy. And to say the least, I've just benefited a lot. I've enjoyed listening to all the discussions, but a lot of take home, from sick care to healthcare, from the future of training in medicine, the future of practice, the issues of precision medicine, artificial intelligence, linking up and collaborations. So, I mean, just to say the least from my own end. So coming from the Ministry of Education, I've just been given a big responsibility to read the closing remarks on behalf of the Cabinet Secretary, Minister of Education. And I think without much ado, I'll just read them. So the representatives from the governments, His Excellency, the British High Commissioner, and the representatives present, distinguished guests, development partners, researchers, innovators, industry leaders, colleagues from Kenya and UK, ladies and gentlemen, good afternoon. Allow, as we come to the close of the fourth KUKA One Health Research and Innovation Conference here, allow me on behalf of the Ministry of Education to express our sincere gratitude to all the participants who have contributed to the success of this particular important gathering. Over the last 3 days, we have witnessed rich discussions, groundbreaking ideas, and practical solutions centered on the One Health approach and the role of research and innovation in addressing some of the most pressing challenges facing our societies. The conference has been successful, bringing together policymakers, researchers, academia, healthcare professionals, innovators, investors, development partners, and industry leaders to explore pathways for transforming health challenges into opportunities for sustainable development and economic growth. We commend the KUKA, the organizing committee, sponsors, partners, and all the supporting institutions for convening this timely and impactful conference. Your commitment to fostering collaboration between Kenya and the UK and the wider global community demonstrates the power of partnerships in advancing science, innovation, and health outcomes. We particularly appreciate the contribution made through the discussions on health innovations, local manufacturing, climate, and One Health, health security, cancer, kidney disease research, commercialization, and all that goes in that ecosystem. These conversations have reinforced the fact that sustainable solutions require multidisciplinary collaborations and strong linkages between research, policy, industry, and communities. Ladies and gentlemen, the true measure of this conference will not be found in the quality of our discussions alone, but the actions that follow. So as we conclude, we carry with us valuable recommendations, strategic partnerships, and a renewed sense of purpose. We must now move from dialogue to implementation and from ideas to impact. In this regard, the government assures you of its full commitment to supporting the implementation of the outcomes of this conference. We shall recognize that research and innovation are critical drivers of national development, economic transformation, job creation, and improved quality of life. The government will offer the necessary support to the relevant ministries, departments, and agencies, county governments, universities, research institutions, development partners, and private sector to ensure, number one, realization of translation of research findings into practical and scalable solutions. Number two, innovation ecosystems that enable commercialization of locally developed technologies and technologies are actually strengthened. Then number 3 is collaborations amongst researchers, innovators, industry, and support, and investors are fully supported. Number 4 is the facilitation of policy and regulatory frameworks that support research uptake and innovation. Then investments in health research, biotechnology, digital health, local manufacturing, climate resilient innovations, and emerging technologies shall be fully supported. And finally, operationalization of full operationalization of the key recommendations and declarations that have emerged from this conference with immediate effects. We particularly encouraged the focus on building an end-to-end innovation ecosystem that nurtures ideas from discovery and proof of concept through commercialization and deployment. Such as approach aligns closely with Kenya's national development agenda and priorities, and our becoming a knowledge-based and innovative-driven economy. We pledge to continue championing policies and programs that strengthen the research capacity, enhance innovation financing, promote intellectual property development, and create enabling environments for innovations and innovators to thrive. To our esteemed international partners, especially our colleagues from the UK, thank you for your continued partnerships and shared commitment to advancing health, science, technology, and innovation. The relationships strengthened during this conference provide a strong foundation for future collaborations that will benefit both our countries and broader African continent. To the researchers and innovators present, your work gives us hope. You are developing the solutions that will improve healthcare delivery, strengthen health system security, address climate-related health challenges, create jobs, build resilient communities. We encourage you to continue pushing the boundaries of knowledge and innovation. As we leave here today, let us carry forward the spirit of collaboration that has characterized this conference. Let us remain connected, continue sharing knowledge, and work collectively to ensure that the aspirations discussed here become tangible realities for our people. In closing, once again, we appreciate the organizers, the partners, speakers, the exhibitors out there, and delegates for making the 4th Hooker Conference a remarkable success. May the partnerships forged here continue to grow. May the innovations showcased here continue to flourish, and may the outcomes of this conference contribute meaningfully to building a healthier, more prosperous, and more resilient Kenya, Africa, and the world. With those remarks, I wish you all safe travels and would officially declare this conference on One Health Research and Innovation officially closed. Thank you, and God bless you all.
Thank you very much, Dr. Another round of applause. I think we would all agree, without much ado, that everything that needs to be said has been said. But as a parting salvo, we were looking forward to the roadmap ahead. This has been a knowledge-based conference. Knowledge, as we know, belongs to humanity. Our brothers from the other side of the world, from the UK and elsewhere, came and imparted this wonderful knowledge here in this forum. Our own Kenyans, with this rich DNA, as humanity, as we know, first began in Kenya on the shores of Lake Turkana. We were told we can get some very good fish. also contributed substantially. So the word and the main takeaway we want to leave here today with is the word partnership. Partnership, partnership, partnership. But as we do that, I would like to thank you, because without this engine and this reservoir of knowledge which emanated from this audience and our people today, there would be no conference. So I want you to give yourself a round of applause. And I want to thank you for this wonderful contribution. Everything that has taken place in this conference can be viewed on the website. I think our website is kuka.org.uk, and it's also, we have live streamed on YouTube, so you can also visit the YouTube site in which everything is documented, and thereafter you can interrogate. If anyone is in need of further contact addresses or any additional information, the Secretariat is still in place. It was set up to serve this conference, and it survives after the conference. From here, we migrate to the UK in July, where we have another KUKA conference with our friends from the UK. So the relationship now is growing. It's becoming visible in the eyes of Kenyans, and it's becoming a reality. So I want to thank you all once again. The conference is now closed, and before we retreat to have our final luncheon session together, could I ask Elder Omere, he's in the house, to come and pray for us with a word of prayer. Where's Elder Omere? Lawrence, he's not here. So then let me call up on another Secretariat member, Wangari. Perhaps you'd like to come and pray for us as we close the conference. Yes, this is Wangari. She's been the driver, the main force of this Secretariat. Isn't she wonderful? Yeah? Give her a please, be upstanding. She's really driven and organized us throughout. Thank you very much. She may say a few words and close with a word of prayer. Thank you.
Okay, thank you, everybody. I was just caught off guard, but it's okay. So thank you all for coming. I don't want to repeat what everybody else has said. It's been a journey, but it's a success because all of you made it here. I'm so grateful, and the team is also grateful. I don't want to repeat what our Deputy Country Director has said, but just as a person, as Wangari, I'm so grateful because the interactions have been so rich. I've met many people that I didn't know, and I'm living here better informed, better connected. I've networked so well. I'm so happy. Yeah, I'm just living here very, very happy. So thank you all. Let's pray. God, we want to thank you so much for everything that you have done for us. As we began, Lord, we began with a prayer, and we are also ending this with a prayer. We thank you for the connections that we've made here. We thank you, Lord, for the provision of safety, even as we were continuing in this conference. We thank you for the deliberations, and we pray that even the outcomes that will come from this will benefit the Kenyan people and will continue to enhance the partnership with the UK government. We thank you so much for all that you have done for each and every one of us, including the facilitators, the wonderful moderators, and all who attended. Lord, may they be safe. And even as they go back home, may they prosper in their ways. We thank you and give you all the glory. For it's in Jesus' name we pray and believe. Amen.
Amen. Thank you very much. And to all the fathers in the house, happy Father's Day. Yeah, happy Father's Day. Come on. Thank you.